Community Oversight Advisory Board. I'm going to start this meeting with a quote from Václav Havel, who was the first democratically elected president of Czechoslovakia in 41 years. And he talks about politics. He says, "Every politics worthy of the name, the only politics I'm willing to devote myself to, is simply a matter of serving those around us, serving the community and serving those who will come after us. Its deepest roots are moral because it is a responsibility expressed through action to and for the whole." I'm reading that as a reminder of why we're here. To take action, to make a difference, to make change happen. This is a board whose members, both civilian and representatives of the Portland Police Bureau, have accepted a responsibility to serve the Portland community. The job of this advisory board, as per the settlement agreement, is listed here. According to the settlement agreement, the COAB shall independently assess the implementation of the settlement agreement, make recommendations to the parties and to the COCO on additional action, advise the chief of police and the police commissioner on strategies to improve community relations, provide the community with information on the settlement agreement and its implementation, contribute to the development and implementation of a PPB, Portland Police Bureau, Community Engagement and Outreach Plan. Those are the tasks with which this committee is charged. I want to welcome Commissioner Fritz. Good to see you this evening. I want to introduce Dennis. What happened? Oh, there you are. Dennis is here. He is the Chicago COCO, and he's here this evening with us. I'm going to let Mandy tell you about where everything is.
Mm-hmm. Hello, everyone. Just very briefly wanted to let everybody know some basics about the setup of the facility here tonight and things like emergency exits. So we've got in this room 2 exits, one that most of you probably came in on, through, and then there's another emergency exit right here kind of off from the stage. We've got 3 exits outside of the building should we be in any kind of emergency, so one on either end of this side of the building and one straight down a hallway. If you walk down that hallway, that's also where the restrooms are. Let's see, what else might I want to tell you? We have sign-in sheets out front, and we have, in our sign-up sheets, our sign-in sheets, we have a place where you can mark if you would like to be in the general public comment period. We also are going to be discussing training policy 1500 tonight, and there are a variety of sort of subsets there. So if you're interested in making a public comment about any of those specifics, please go outside and put your name up on the list. We definitely want to hear from you tonight. I went over restrooms. I think the last thing is the toy box, which is for anyone to play with toys should you need to tonight. I don't think we have any kids here, but I do have a toy box just set up in the back in case we had little ones, or seriously, if you need to play with toys. I think that is about it. Brad Taylor is our mental health support specialist, and he is here for many reasons, but one is to support people with special accommodations. If there's anything that you need tonight, or if there's anything that you think would be helpful for meetings in the future, or for yourself to be able to be at these meetings in the future, please talk to Brad, and he's just off back in the corner right here. So that's it. Thank you.
Thank you, Mandy. In your packets, you have a blue sheet of paper, and you just got it today, so I'm not going to ask you to vote on these ground rules tonight. But I would like to review them with you and ask that for tonight, you consider them in effect so that we can move forward with some guidelines. These were taken, Use of Force Committee brainstormed some ideas, and so they served as the basis for the development of these guidelines. We assume responsibility for the quality of meetings, discussions, and outcomes. We agree to abide by our ground rules, critique ideas, not people, work toward shared understanding, speak from personal experience without generalizing, use I statements, avoid crosstalk, listen respectfully when others are speaking, listen actively and attentively, seek to understand, share the air, refrain from monopolizing discussions, and encourage participation by everyone. Challenge ideas in a respectful manner, avoid put-downs, even humorous ones, or attacks on individuals. Ask for clarification when unsure or confused. Exit meetings in a way that is non-disruptive to the group. Turn cell phones off or to vibrate, and make no calls or texts during meetings except in case of emergency. During meetings, use laptops only for meeting business. Use the parking lot for thoughts and ideas not relevant to current conversation. Recognize the legitimacy of people's feelings and support members in expressing their feelings in ways appropriate to this setting. Anybody have any problem with anything on that list? Yes.
Were there any people with lived experience who were a part of this brainstorm?
Yes.
And this is a use of force committee?
The original core of ideas came from a use of force brainstorming.
And you're saying that there was a person with lived experience who was a part of this process?
I don't know who was a part of the brainstorming part. I'm talking about who put it together finally, okay? Okay? I'm not asking you to vote on it tonight. I'm asking just to have these as guidelines for operating this evening, okay?
Okay, so one thing I would suggest to the COCL or the COAB, whoever's designing this outlay, is to have it, I think Brad mentioned this in the March 12th meeting, to have it up on a visual.
When we get, you haven't approved it yet. The COAB gets to approve this. So right now, next month, it'll be on the agenda for your consideration. Between now and then, I would like to hear from you about things that you would like added,
Okay.
changed, or deleted, okay?
I just wanted to add that little bit. Thank you so much.
Okay, thank you. So are we agreed, sort of have a consensus that we can work with these tonight?
Sure.
Okay, thank you. Yes.
I think anyone can have a lived experience because we're all human beings and we all have horrible things that happen to us in our life. So we all have some lived experiences. Everyone.
Okay, and I don't want to get us off into that discussion right now today. We will get there.
I'm just
okay?
saying.
All right. I would like to proceed with the agenda, please. Please remember to talk into your mics. We've had trouble with people not hearing us. It's also the case that if you don't talk into your mic, then the video may not pick up what you're saying. And so when people listen to us on TV, Channel 30, they may not understand what is going on. So please remember to talk into your mics.
May I add something to that?
Sure.
And if you can use the paddle for whoever's talking and talk one at a time, just indicate who's talking, that would be a big help. Thank you.
That's the next thing on my list, Philip, thanks. Remember to use your paddles. Thank you. So talk in your mic, use your paddles, respect one another. We're going to talk about the COAB work plan, and Amy's going to take you through that work plan.
Good evening.
Good evening.
So underneath your agenda packet, you had another handout. It says September 2015 at the top. And I apologize, I need to put the extras out on the table. We have a few over by Mandy. So this is a document that was compiled from several different inputs. The executive committee walked through it at their meeting a week and a half ago, and we will continue to bring it to the executive committee every month So they are reviewing the work of the COAB for the next several months, which then gives subcommittees and everyone else on the COAB the opportunity to know what to expect and also to plan subcommittee agendas around what's coming up at the full COAB. So the major inputs into this document are the Universal Policy Review, which we'll review in more detail later tonight, the plan that we've put together to work with the Portland Police Bureau to develop the Community Engagement and Outreach Plan, and the quarterly reporting schedule. Those are the three major items that have driven this timeline. There are additional items on here, and that we would like to add additional items on here of things we've heard from subcommittees and from other groups that should be added to the agenda. I know the Mental Health Subcommittee has talked about bringing in a representative from NAMI to talk about stigma, and we've had other ideas bringing in presentations around recruitment and hiring. So with that, I'm not going to walk through it line by line. If you have any questions, though, I'm happy to address those, and we will bring you a fresh version every month at your meeting, so you have the next month in front of you and the upcoming 6 months behind that. And we'll have it posted on the website as well.
Any questions on this at this point? Yes, Abel.
Thank you, Madam Chair. Just a reminder that we need to approve the minutes. That was the first agenda item.
Yeah, you're right. Okay. Has everybody had time to read the minutes?
I propose to approve the minutes.
Can I get a second? Well, you got about 3 seconds there, yeah. Okay, any discussion?
I have
Okay,
a couple of corrections, please. On page 9, and again, these are the minutes from 8/13. On page 9, about the middle of the page, there's a topic titled Discussion, and the remarks that I made are attributed to Tom Steenson, and I don't know who made the remark before that. I don't recall asking that first question, but I did make that second statement that's attributed to Tom Steenson.
okay.
Also, on page 11, correcting Dr. Haynes, the spelling of his last name.
Page,
11, last paragraph.
okay. I saw another hand. Rochelle?
On page three near the bottom, under some comments about Tom Steenson providing an update, it says that the committee is working on recommendations for use of force 10-10-10, and actually it's just 10-10, because we presented on 10-10-10 last time. I know that's a little confusing.
Yeah. Any more hands? Any more comments, observations? Yes, B.
So we just received this one, so I'm working off of the copy that we received via email. And I don't have any page numbers, but it's more or less the second page. It says, Me Laviani V wanted to make sure it was known, and then in shades it reads, Amy, what did she want to have made known? And on the side it says, I don't recall likely about her vote on the bylaw amendments via phone. I believe she was registering frustration with being heard via phone. So I just wanted to again reiterate that it would be fantastic that if and when people are involved in a teleconferencing or involved in the committee via teleconferencing, that people don't talk over them. Obviously, my point isn't to make accusations or anything, but rather to make sure that there is in fact full participation from everybody that's teleconferencing.
Agreed.
So, there's that one. And then there's something else, but I have to see here. Anybody else?
Okay, take another 1 or 2 minutes, and then we'll call the question on the minutes. V?
So I guess it would be page 1, 2, 3, page 4 of the email distribution. Second to last paragraph. Miliviani v. Riviera noted that since its inception. Are you getting that, Mandy, or whomever?
Will you say where it is again?
Sure, it's a second to last paragraph.
Page 4, did you say?
Yeah. It starts out, Miliviani v. Riviera noted that since its inception, the COAB has lost 5 very important members. The balance of the, okay, so more pointedly, the balance of the COAB is woefully unbalanced, or the composition of the COAB is woefully unbalanced. And my driving point, the spirit of what I was attempting to communicate, is that the people with lived experience, there's not enough representation. Certainly with those that are vets, right? I don't know if you recall that
Yeah.
that comment that I
I'm
made.
wondering, you want to add those words to this? Is that what you want?
No, I do not, because in fact, that is exactly what I more or less said. I'm paraphrasing myself now from the last COAB meeting, but I specifically mentioned that, as well as the unfortunate loss of Christy Jameson
Okay.
to the COAB.
So V, I'm asking if there's something you want changed in this paragraph.
Yeah, I'd like it to more accurately reflect what I said, which is what I just enumerated, if that makes sense. Does that make sense, Mandy?
Yeah, I mean, one of the things I'm hearing is that, so, yeah, there's not enough representation, and you mentioned vets specifically in the
Most
last
definitely.
comment, okay.
People are having trouble hearing you, Mandy.
We do not have a mic. That's what I said. Thanks, yeah, I just wanted to make sure that I understood V correctly, and I did, so I've got that written down from what you've just said. Thank you. Yeah.
Okay, and then further on, I guess it's the last sentence in that paragraph. This last sentence. I think that the community, right, when they had the selection committee, was very pointed about what sort of representation they wanted the COAB to be composed of. Sorry about that trailing preposition, but and I think that's something with respect to the executive committee, if in fact not maybe the entire COAB, but most specifically the executive committee, that needs to be addressed, whether that means restructuring or whatever. I think that the executive committee can work on that, and most specifically
Is that something that's in the
and most
minutes
specifically
that you
the-
want
that
changed
the-
at this point?
And most specifically that the general COAB can take care of.
Okay, but are you asking me to
I'm-
change something
what-
here?
Right, what I'm trying to do is express, because this sentence, I'm not accusing the DOJ of, sort of not knowing what they're doing, but more that I think that the executive committee and the COAB, general COAB can resolve this issue. I believe we can.
Okay.
So I hope does that make sense, Mandy?
I mean, what you're saying definitely makes sense. I'm just trying to figure out how it is different from what's in the
Okay.
minutes.
What I hear is that you want something added to the minutes that's not there. And that is, my question is, was that a part of the conversation at the time? Because the minutes are used to capture what happened, not what should happen.
Certainly, I hear what you're saying, and I'm not really trying to add anything. I'm trying to capture the spirit of what I said, because I don't remember exactly what I said. I remember
Okay,
talking about
okay.
Josh, and I remember talking about Christie.
Okay.
So,
I think your concerns are so noted. Okay.
excuse me?
We have noted your concerns. Yes. Okay. Anything else? Okay. I had a motion and a second for acceptance of the minutes. We've had discussion. I call the question. All in favor of accepting the minutes, please indicate by holding up your paddles. Are there people without paddles? Or are there people who just don't want to vote? We've got Rochelle, we've got, I can't see that far. Do you have them? That was 4, right? I will. Against? Abstentions? The minutes are approved. Okay?
In regards to what Dee was talking about, that action item to follow up on the representation, was that to be followed up this meeting?
I think it's a recommendation that we will take under consideration. I think that there are things that maybe we need to discuss about what the bylaws say, what the expectations were in setting up the committee. I think we're not prepared to have that conversation tonight.
Okay, I just seen that.
Okay. You've just taken a look at the work plan for COAB, and you have in your subcommittees additional information on what you'll be doing. And it's getting clearer and clearer to me that this work cannot be done with one meeting a month. I am not offering the proposal tonight. I am offering a warning that I am going to make a proposal that we meet twice a month. One of those meetings would be a business meeting where decisions are made, votes are taken. The second would be an informational meeting. We need information. If we were to put all that we need into this meeting, it would be a day-long meeting. So I am going to bring that to you at the next COAB meeting. You'll have the written part before then, okay?
Is there any discussion on that?
Not at this point. You don't have a proposal yet.
I mean, to make a comment.
If you need to, Sharon, go ahead.
Okay, so based on the fact that we know that supposedly this is a 5-year plan, but there have been recommendations that this is a 10-year plan, because really we are volunteers and we are giving more than 10 hours a month, and the work is heavy lifting and it's deep as it relates to healing and building community relationships with the community and the police. I don't think it is fair that volunteers from the community who are giving their time have to work additional hours with therefore no compensation. Also, the fact that we, the community, are the injured ones in this case and in this settlement agreement, and the fact that we're giving a lot more time than was initially expected. So I would really like for us to consider how we think about this work, knowing that it's going to take some time. So, yeah.
Yes, it is going to take some time, and that's what I'm proposing, that we take more time. And you can argue and you can debate this when you have the proposal. This was simply a warning that the proposal is coming. Subcommittee reports.
Okay, so we only have 4 minutes for each subcommittee, so I'm going to be quick. Forgive me. So the first issue that we discussed in the last executive committee meeting was whether the existing model of representation previously agreed by COAB should be changed. My understanding, Amy, clarify if I got this wrong, is that DOJ and city have told us that they see the model that we used to put the executive committee in place as still in force, and that if we want to change that, then we would want to put a motion on the table to modify the bylaws, and then we're free to make that change. We have testimony in front of Judge Simon. The date on that is October 22nd or 21st, and we will vote on the results of the team working on that on October 8th, which is our next COAB meeting. We're going to be soliciting chair inputs on accomplishments. We will be meeting with the team who have agreed to work on that and to advise that next week to formalize our final draft for COAB review. We reviewed Amy's awesome schedule, and you saw the results of that today. We reviewed the process for communications and reporting. Our objective with this new process is to better engage our stakeholders and the parties to get help, to clarify direction, and thereby to empower COAB from the very people who helped create the settlement agreement, helped create the DOJ investigation that led to the findings. And then also, we feel that we'll be able to provide a more transparent and planful approach to the public and a much more professional approach. We also discussed having chairs of the subcommittees at the executive committee. There's an issue regarding quorum with that, which I think has been referred to city attorney as far as trying to figure out what we would do there. But we do feel it's very important to stay in communication with the chairs of the subcommittees. Public testimony was received, including, which was read into the minutes, Portland Cop Watch's comments on gang list training pursuits and other directives for August 2015. We received that with great appreciation from Portland Cop Watch, so thank you very much. We reviewed the spreadsheet of proposals for the executive committee. There was a proposal that Tom chair the COAB. That conflicts with the settlement agreement that assigns that to the COCL, and so that was declined 4-0. There was one member who was not present to vote. Consensus model and inadequate advocacy for mental health community. The executive committee does not agree with the statement related to mental health representation. Members who have left have also left for their own reasons not related to mental health. The decision on the consensus model will be left to the chairs of the subcommittees, but we do not encourage it because of its cost and cumbersome nature. That was approved 4-0 for that response. 6-month term limit on executive committee members was previously declined 3-0, so we declined to raise a second vote on that. Subcommittee chairs to be added to the executive committee. That was Kathleen's suggestion. That was withdrawn. However, again, see the communications and reporting process that we're proposing, as that would try as best to engage them. The COAB role in recent events with PPB, this refers to if there were a use of force incident, a shooting or what have you, how would COAB relate to that event in future with PPB? We're referring that to COPS, and we'll ask them to coordinate with HRC and CPRC to develop a plan and recommendation for the CEO plan to incorporate that. And that was accepted 4-0. There was a proposal to involve Chief O'Day and the assistant chiefs more directly in the COAB. What we agreed was we would clarify the communications process so everyone knows there is engagement from higher level PPB. That was agreed 4-0. We had a request to revisit timelines and provide better opportunity for community feedback. I withdrew that based on the fact that Amy's plan now incorporates that very thing. There was a request for a minority report. That was declined by the executive committee 4-0. Full COAB meetings were proposed to be placed at the Jewish Community Center. PCC Cascades, this location, has been selected, so that was declined 4-0. There's a proposal for a media subcommittee, and that was also declined 4-0. And we set the agenda, and we've agreed that Sharon will start working on a 2016 budget. Thank you, Sharon, very much. We have some points of clarification we need to get on that, but that's something Sharon's going to be undertaking soon. Thank you.
Thank you, Bud. Alicia and Sharon, Mental Health Crisis Response Subcommittee. Oh, I'm
May
sorry.
I?
Yes.
If I may contribute to the Executive Committee report as a sitting member of that committee, I'd like to propose that the subject of stipends for COAB members go in the parking lot, and that the Executive Committee revisit its earlier discussion about stipends for COAB members.
Thank you. We'll put it on the parking lot. I think that's happening right now. Okay.
Do I push? Oh, no. My name's Sharon Myron, and I am co-chair of the Mental Health Crisis Response Subcommittee of the COAB, along with Dr. Morlan Capuya. And I'm going to start off, and she'll finish up, but we'll both be brief. First of all, I wanted to express my gratitude for members of the community who attended our subcommittee meeting. It was extremely well attended, and a lot of individuals made some just really valuable input that made a tremendous difference to what we were talking about. So I wanted to say thank you. And we have tried to incorporate all of this into our recommendations moving forward. So one of the things that we were charged to do was looking at the 1500 training policy and making recommendations for the broader COAB to approve. And so we came up with, how many? 5. Thank you. 5 recommendations. And first of all, we recommended adding a glossary, a list of definitions of names and terms which are included in the policy to clarify, because there were a lot of terms and phrases which many of us were not familiar with, and so we thought that that would be helpful. In terms of the pros, that would...
Sharon, can you excuse me for a minute? We're going to go over those later, I think, and actually get a vote on whether to forward them. Do you want to go over them now and do that whole process now, or do you want to include that in that process? Because that means we get some public input on what your recommendations are.
Well, how about, since that was the bulk of what we talked about at our subcommittee, I can go through them quickly. We will not, I do not want to have a discussion about them now if we can avoid that now, but maybe just put them out there briefly so people are aware of them, and then we can have the discussion at the...
We can do that.
That would be one of our recommendation. We would also recommend adding language regarding delivery and the instructors, recommending that training instructors include more voices from outside of the Portland Police Bureau, including community members and individuals with lived experience. And we can go over the pros and cons of that a bit later. We recommend that training include a cultural responsiveness to the houseless community, those impacted by mental illness, and other marginalized communities. We recommend that policies include clear attribution of who developed the policy and a clear contact for that person that's publicized, so people know who did what and can get in touch with someone, with a real human, if they have questions or comments. And then there's some additional, very more specific recommendations that were made that we can go over a little bit later, that were from a prior meeting. And Dr. Moreland Capuya will help provide those.
So I want to just step back a little bit. The Mental Health Crisis Response Subcommittee has been tasked with sort of the centerpiece of the settlement agreement, which is that the Portland Police Bureau had been found to have excessive use of force in a particular niche population, those who were in mental health crisis or with perceived mental health crisis. And so our subcommittee has really been tasked with concerning ourselves specifically with policies and procedures, with hiring practices, with training, and reviewing those and really in some ways scrutinizing that, and with an eye and attention for being sensitive to the subject or the issue of mental illness and mental health, which are two different subjects, but we are concerning ourselves with that. We meet every first Thursday. Our meetings are now at 7 p.m. From 7 p.m. to 8:30 p.m. We invite you all to come join us. They will now be held at the Center for Intercultural Organizing, which is literally right across the street from here. We had a very successful meeting last week because we had probably 15 well-engaged community members, and we appreciated their input. The way that our meetings run is that you're not really a stranger. You become a part of the group, you engage, you offer your thoughts immediately, real time, and they're integrated into what we bring back to this body. And the things that we'll continue to look over, I think it's interesting that Kathleen has made the proposal to have another meeting, because I see the subcommittees as really the space where the real work should be done, meaning that's the place where you should be able to sort of wrestle with things and argue, and the purpose of this larger COAB should be to sort the business end of it in terms of making the decisions on the business end. So we'll continue to work as we have. So we did spend the bulk of our meeting looking at the 1500 training policy, which we'll review today, and we'll talk a little bit more about the recommendations that emerged from that discussion, and we'll continue that. We're also looking at the types of information that will be required for not just the larger COAB, but for our subcommittee to optimally do our work. So we're trying to receive information as we work to make the best recommendations moving forward, to support the COCL, the COAB, and again, with the primary mission of understanding that we're all here because we need to make some decisions about how to better treat those with who are in mental health crisis and support them, and to support the police, Portland Police Bureau, in doing an improved job in that area. So again, we're doing a lot of work. We do get down to business. We're efficient. Everyone is welcome, and everyone's opinions are valued. So do join us, and we'll stop there. I think that's the bulk of our time.
Thank you. Yes. Tom, from the Data Systems Use of Force and Compliance Subcommittee.
I'm currently the vice chair of the Data Systems Use of Force Compliance Subcommittee, and unfortunately for the subcommittee, the chair, Sharon Maxwell, has resigned in order to serve on another subcommittee. So I may or may not be the chair. We developed and presented and had passed at the last COAB meeting recommendations on 10-10-10 relating to IPR review of matters, the 48-hour rule, and other procedural things related to investigations of the use of force. We have adopted in our subcommittee sort of a model of using work groups to sort of do the heavy lifting in terms of looking at policies and training. Frankly, that's a tremendous amount of work, and those of us who have the time are spending a lot of time looking at policies, finding best practices throughout the country, involving community members, getting input from Portland Cop Watch, various advocacy groups, and developing recommendations. Currently, the Bias-Free Policing Work Group has a set of 9 recommendations which have been discussed at the subcommittee level and will be discussed again at our traditional or scheduled third Monday meeting of every month. And they will be voted on this month, and then, depending upon the vote, of course, presented to the COAB for its consideration. The use of force work group, which had developed the 10-10-10-10 recommendations, has been working on recommendations regarding what the DOJ considers to be the main, or the what they call the trunk force policy, and that's 10-10. We currently have under development 25 recommendations to essentially completely rewrite 10-10, the existing use of force policy. The work group has found it to be inadequate, not in compliance, or not up to par with best practices, not up to par with DOJ-approved policies in other cities. And we expect to present those to the subcommittee this month as well. Because the DOJ has asked for those recommendations, to the extent that they're considered and passed by the COAB, to get to the DOJ as soon as possible, we're pushing to have them on next month's meeting. If I can have a word, you haven't scheduled a report on the accountability subcommittee? It's not on the agenda?
No, is it on the next one? It is, yeah.
Okay, if I can switch. Recently, the COAB at the last meeting authorized the creation of an accountability subcommittee. That subcommittee has a great deal of work to do. Unfortunately, so far, there have been only 2 COAB members who have volunteered, because of time considerations, I think primarily, to work on that committee, V and myself. Fortunately, because of a call out by the COAB soliciting contributions or membership from people who had applied for the COAB and were not selected, at our initial meeting a week ago, we probably had about 15 people in attendance, much like the Mental Health Committee, which was great. And there are people that are experienced and engaged, and they want to participate. And so I think we're going to be able to staff that subcommittee, probably not with many COAB members, at least currently, because people are just busy. But I think the subcommittee is going to get launched, and in terms of what we're going to be doing exactly and how we'll do the work is sort of still up in the air.
I want to point out that we got Sergeant Hughes volunteered to be on that committee.
Yes.
At our discussion, we said there was no police voice in the room, and so we now have a volunteer for that.
Right, and that's good. Yes.
V, did you want to add anything to this since you chaired that committee meeting?
Well, no, I would just add that, everything Tom said is on point, and further that we've decided to have 4 speakers over the next 2 months, 2 meetings, and then after we have built the requisite foundational knowledge, then we're going to be breaking up into work groups. I'd also add that we're lucky enough because Rochelle Silver, who's, I believe, highly qualified with all her experience, has decided to not join the subcommittee, so i.e. participate. So, but I think she would join if everybody could be on 3 or 4 or however many subcommittees they wanted. So.
Okay, thank you. Any questions or discussion? All right, we'll move on to the Community Engagement and Outreach Subcommittee. Jimmy?
Good afternoon.
Talk into your mic, please.
Hi, Jimmy Johnson, chairperson for the Community Engagement Outreach Subcommittee. We've been working pretty hard. It's been pretty busy and somewhat hectic. We had a pretty good meeting and a pretty spirited meeting a couple weeks ago over at the Northeast Precinct with several community members, maybe 5 or 6 community members, and 4 or 5 of our subcommittee members showed up, and we discussed engagement and outreach, and we discussed how we can get out and represent, get out and speak to what's going on with COAB, and speak about what just identifying places. One of the things we talked about was identifying venues, for example, places where community events are taking place, and talking about having someone from our community engagement outreach subcommittee be there, or someone from COAB be there, and not necessarily as a representative of COAB or as a representative of the community engagement, but just to be there for information and gathering, as well as information sharing. So those are a couple of things we talked about. A few other things we discussed was the surveys. We talked about the surveys being turned in, and we're having a good response on the surveys. I mean, compared to what we thought, I think the surveys are coming in pretty well. I think I don't know, correct me if I'm wrong, but I think we had over 800 surveys returned so far, and that's a good number. Let's see what else. Also, we discussed getting other members from different groups. For example, Sam Sachs. I spoke with him. He wasn't at our last subcommittee meeting, but I spoke with him over the phone and spoke with him a couple of different times. And he said that he'd be at our next subcommittee meeting on next Thursday. We meet every third Thursday. He said he'd be there and share some input and just get involved. And one of the things we were discussing was getting other folk involved in becoming part of our subcommittee. Community members, they can come in and sit and listen and take part in our subcommittee. And after that, they feel like it, after a couple of meetings, they feel like they want to be a part of our subcommittee, just a permanent part of the fixture, they're welcome to join our subcommittee. So as a community engagement outreach. So we're always looking for more input and more members and more ideals. One of the things that we discussed was, again, meeting with neighborhood associations, the seven pods, or the seven heads of different neighborhood associations. We talked about going over there and meeting with them and just informing them and letting them know what we're doing and where we're at, and as it relates to outreach, and also as it relates to the COAB. So those are some of the things we talked about. And we also, again, and I think we're going to talk about this later in the meeting, I'm not sure, to correct me if I'm wrong, Kathleen, but
You should do it now.
the COAB Speakers Bureau.
Yeah.
Yeah, that we definitely, I don't know if you guys may have a handout or not, but we talked about the COAB Speakers Bureau, and that's going to be an important piece. I'm just going to go to read it here. The purpose of it is to establish a tool that will help the COAB communicate with the public in order to inform it of the COAB activities and progress, and to hear from the public its concerns and compliments. So that's a part of it. The mechanism, the group it's a group of trained speakers who can represent the COAB and are qualified to talk to the public about COAB business. Again, this is something that we're talking about getting done. It hasn't been in play yet. It hasn't started, but once we get this up and running, I think it'll be a really great asset and to the COAB and to the public as well, as far as knowing what we're doing and the transparency of how and why we're doing what we're doing. Speaker characteristics: these are volunteers who are interested and knowledgeable about the COAB, and who are able to carry out the COAB's message to the public. So again, anyone out here that's interested in becoming a part of the Speakers Bureau can contact, I would think any of the COAB members, but specifically myself as the chair of the Community Engagement Outreach Plan. We're looking for volunteers. We're looking for folks who are interested. We're looking for the public and the community to become really engaged, because this is really about us. It's about us, the public, us, the community. Why develop a speakers bureau? They can be used for a variety of purposes, such as raise public awareness about COAB issues. Issues can be explained best by those who are working directly with them. Speakers Bureau can increase the COAB's visibility. Speakers Bureau, we can reach a large number of folk. When I come in here today, I'm glad to see you all here, but it just really do my heart good to see this room filled up at this meeting. We're working toward that. So with the Speakers Bureau in play and going on, I think we can get more people involved and more people understanding what we're doing. And again, transparency is the big thing. It's the key. We want everybody to know what we're doing and why we're doing, and from the public on how we're doing what we're doing and how the public think that we can do more. Again, I'll mention it again because we are the public. We'll increase COAB visibility. And also we'll increase the Speakers Bureau again. We'll increase the public understanding of what the COAB does. And as a part of the Speakers Bureau, we can create recruit new voices. And that's very important to me, and I think that's very important to the COAB, that we do create new voices and that will come in and add to the process as we move toward this historical process with reform, police reform, and how we do business in Portland, Oregon. And also another thing is, of course, attract media coverage. We like media coverage. I would like to see more media coverage. I would like to go in a place and when you hear people talking about COAB, or somebody mention COAB, or somebody mention any of the subcommittees, or mention what's going on, they will be able to have understanding of why there is a COAB and what COAB is doing, and how the COAB and COCO are working together with PPB and the city of Portland to make this a better place, to make us all better engaged in what we are doing and have a better, a better place to live, and a better place to play, and a better place to stay. And with again, with reforms and with trust being built, and I see this too as very important to build trust, to really build trust amongst each other. That includes the board as well as the folk who are now part of the board, but the folk here, the public. Those are some of the things we're talking about and outlining in the community engagement outreach process. I'm
gonna call time on you, Jimmy.
You gonna call time on
Can
me?
you wrap it up?
Okay. Let me see. Who can you reach with the Speakers Bureau? Okay, well, I'll just go on real quickly. Business groups, service organizations, faith-based groups, workers groups, political groups, classes at local schools and universities, as we talked about that in our last meeting as well, professional organizations, community-based organizations, and cultural groups. So with the Speakers Bureau, we can reach an array of people and a variety of people from all different cultures. Also, just one more thing.
Okay, one more sentence.
We did have a brief meeting, and I was really pleased with the meeting, just the meeting itself. We met with Captain Mary and Captain Mike. Met with Captain Mike. We met with Chris. You heard all of the Portland Police Bureau. We met last week and had about an hour meeting just to discuss some things and how some things should look. And this is something that we will be doing further in the future because this is a part of the settlement agreement and part of the settlement plan. And with that, I'll just turn it back over to Kathleen.
Thank you very much, Jimmy. Any?
Quick?
Yes, B.
Take 15 seconds. I just want to take time to thank Randy and Shelley Morgan for showing up. It means a lot to me. So thank you for coming, and I appreciate it.
Okay. Back to our agenda.
From PPP.
Okay,
Excuse me. Thank you.
we're going back to our agenda.
Yes, ma'am.
Rochelle.
So I'm wondering, to follow up on what Bud said with the executive committee, where we are on the charter and where we are on the membership of the executive committee, please.
The charter at this point, the question was raised, do we need one? And some of us think we don't, so we're discussing that. The second question was,
Where we are with the membership, because that came up as a result of the presentation of the charter last week.
right, and I think part of that was addressed earlier about having to change the bylaws if we want to change that structure.
That the bylaws are silent on the membership of the executive committee.
But the intent of the original formation of the committee is what is standing and what has influenced the configuration of that committee. So if you want it not to be silent anymore, then the thing to do is make a proposal to insert something into the bylaws or change it. Otherwise, we are following the intent that was established when the committee was established.
So do you want a proposal tonight, or when do you want this proposal?
I don't want it tonight, because I think we should allow enough time for discussion if we have a proposal tonight.
Well, I'm afraid that this is going to just get lost.
Right.
I don't think it'll get lost if I can get a proposal. And I think if that proposal came to us in the form of, we would like to do this, we would like to amend the bylaws. Yes? Hold on.
Amend something that's silent.
We would like to amend the bylaws and have some discussion and a vote for the full COAB, because that's what it's going to take. Now, Amy.
The bylaws do say, the very last paragraph of the bylaws are the procedure for changing the bylaws. So I believe it needs to go through a committee, double check that though, but there's definitely a 14-day notice requirement for the COAB before they can vote.
Yvonne?
Thank you. I would just like to point out that I believe that we've already established a precedent for how membership of the executive committee will be selected. The precedent was established at our meeting where we had nominations from the full voting COAB membership, and then an election or decision was made. I think the precedent is already there, and that we just need to follow it.
What I would not like to do tonight at this point in time is discuss the bylaws and changes in the bylaws, because that is not what our agenda calls for. Our next item on the agenda is a guest speaker who has been waiting a little past the time we promised. So I'd like to move on to that unless there's something pressing at this moment. V.
I thought we were supposed to have public comments before the speaker.
No, that's not what the agenda says tonight. I think the chair has the option to change the agenda, okay, depending upon requests and availability, direction, focus, and what is intended. We have invited a guest speaker tonight, and we tried to arrange for that speaker to be able to present and leave. Would you like to say something?
Two was this was information sharing, and we wanted Dr. Ferentinos to be able to present so that then the public could also comment on that. So we're wanting you to be able to sort of participate in that comment, which was the true essence of why we wanted to have her speak and then public comment.
So just for reference, less than 24 hours ago, the agenda went out to the public and then something was modified. That has to change. If you do it late minute, for whatever reason, the point is that, don't set a structure if you're not going to stick to it.
Noted. Thank you.
It's should be more than noted.
No, noted, and we'll do something about it. Thank you. Thank you very much. Go ahead.
I'd like to just briefly.
Can we get a mic, live mic back here, please? What's happening?
Welcome. I'm a little like.
But I could just speak with my regular voice. Can you hear me? All right, so brief introduction of our guest speaker. Dr. Chris Ferentinos. I first became aware of her and her work to develop a center to address care of individuals with mental health crisis when I had an op-ed published in the Oregonian about the barbaric treatment of individuals with mental health crises boarding in the emergency departments. She immediately contacted me. She is the director of behavioral health at Legacy, and wanted to talk through the issue, what I saw, and had a deep understanding and caring about the problem. She's charged with addressing, as part of what the settlement agreement requires is a, quote, drop-off center. The CCOs are supposed to be working on it, so the settlement agreement doesn't have the authority. But she is spearheading the effort to develop what is now known as the Unity Center. And there are lots of rumors about it. There's conceptions, misconceptions, and so she's here to present that and describe it to you. She is, I just have to say, I so admire the efforts that I've seen of her to include individuals with lived experience, peer groups, people who care directly, family members of people with mental illness who have faced crises. She is a psychiatrist herself and also involved in public health. And I'm really pleased she's able to come speak with us today. So there you go.
Thank you.
Dr. Ferentinos.
Thank you. And thank you for such a generous and nice introduction. So I will do a summary of what Unity Center for Behavioral Health is supposed to be. It's everything is in development, so there's a lot of things that they're truly in development. And then I'm very happy to try to address any issues, questions, suggestions, etc. So when I came to my job at Legacy, I started doing a environmental sort of scanning of what was going on, and the first thing that started coming to my attention was the crisis of individuals in mental health crisis that were being boarded in emergency departments for days sometimes, and not having the correct treatment that they needed, and in an environment that was very distressing to anybody, let alone if you are having the worst day of your life. So based on that, and based on the fact that at the same time 4 health systems came together to talk about the possibility of coming together to consolidate their psych units, so Adventist, OHSU, Legacy, and Kaiser. Kaiser does not have acute psych unit, but was very interested in actually having a place in which they could influence the care model and create a better care model design, transitions of care, et cetera, for their members. So they came to the table as well. And with the leaving of the Oregon State Hospital from the building that Legacy owns here in Portland, which is the old Holiday Park hospital, that opportunity presented itself for that consolidation of services coming together of health systems that normally actually compete with each other. But if it was just that, we would be just changing the chairs, like a dance of the chairs, and maybe creating a better experience for patients that need that level of care, that acute level of care, because the crisis is too intense. But then we did some research on what are other models around the country that could address individuals that are presenting with a crisis and have today in our community no place to go. And one of the models that we looked at was a psychiatric emergency service, so a 24/7 facility that can be available and open to walk-ins, police, ambulances, and et cetera, basically offering the expertise of addressing a mental health crisis. And not just that, because in fact I have talked to many of you that are many familiar faces, and have received input from a lot more people, and we really felt that that would not be enough either, that we needed to also address this a place where individuals that are voluntary, that are actually in crisis, they are depressed, they're sad, they're having the worst day of their lives, and they need to talk to someone and need perhaps some help with their social needs. And so we're creating a psychiatric emergency service that will also have what I'm calling a living room, but maybe we'll change the name. We're still studying the concept, but a concept of a place that it's very warm, very well-meaning, receiving, full of hospitality for individuals that are in crisis, that can come and talk to other individuals with lived experience, peer support specialists, social workers as well, to help with that crisis. So we're trying to create a environment with a continuum of care that could address both perhaps a more intense, severe mental health crisis that demands more medical treatment, as well as addictions, as well as an individual that needs somebody to talk to because they're very sad and very depressed, or very something, just need some help. So Unity Center for Behavioral Health will have 101 beds. We'll have 4 adult units and 1 child and adolescent unit. 22 of those beds will be for child and adolescent individuals, and the other 79 for adults. I think the one thing that we're doing differently also from what we have today is most of the rooms will be single occupancy rooms, because if an individual really is in crisis, and it's so hard sometimes to have double occupancy rooms because you have so many. It's like a puzzle to put 2 people together, and so a single occupancy room is just much more flexible, better for the individual and for the care. So the majority of the rooms will be a single occupancy. We're also going to co-locate in this facility, and I don't have all the details, we just started on that work, a community hub, if you will, for assisting individuals in the transitions of care. So what we have right now is assembled a cabinet of folks that come both from the payer side and as well as the community-based organization side. So just to name a few, Cascadia and LifeWorks and other Trillium, other places, both kids and adults. And in this cabinet, what we are at this moment is designing what's the work ahead, so we can design together as a community a model for transitions of care that we can then present back to the cabinet and to our funders to see that it can be funded. And I guess my vision is that we would offer navigation, for lack of a better word, a help and support and navigation for individuals that are transitioning. Either they came with a crisis to the psychiatric emergency service, or they needed to be admitted to an inpatient bed, but they are now being discharged and they are transitioning, because this is an acute care facility. But what's the missing link of an acute care facility is the transition of care, is how you do the handoff to the next level of care. And all of the things that accompany that, both in terms of support, but also medication bridging and all of that. I forgot to say one thing about the psychiatric emergency service. Many of you already know what I'm going to say, but I'm trying not to assume that you know, so I'll just say it. So we're working within a construct of an observation model, and so the philosophy behind it is that some individuals that are in crisis, that crisis can be I don't want to say resolved completely, but they can be stabilized within a period of 24 hours. For some of you that have been in an inpatient acute psych unit, you probably agree with me that you only want to be there if you really need it, because it's really not that much fun. It's a place, it's much more for safety than anything else. And so we want to create this observation model in which we can actually treat individuals in still an outpatient status without having to admit them, and return them to the community whenever it's possible. So anyway, the last thing I want to say before I open up to questions is that we see the work we're doing as really based, I mean, it has 50 million parts, but I'm just going to simplify really a lot and say that it's 3 big parts. And one part being, how do people come into Unity Center? And in that regard, we have a work group that is a transportation work group that looked at some of the stuff that folks were doing in California, and they were able to influence their police and ambulance companies to, in a way, eliminate the police out of the business of transporting individuals in a mental health crisis to the hospital, because truly should be considered a medical emergency. And a medical emergency should be transported not by a police car in the back of the car with handcuffs, but with an ambulance, with a transport that transport people with a heart attack. So we have been able so far, and we'll try to get there, to convince a lot of folks that that's a better model. It's a big change for our communities. We're talking about the Tri-County area, and we have Fire Bureau, the ambulance companies, Portland Police, but other county sheriffs, and everybody and their brother is part of that group that is trying to really create this new workflow in which we would then, in some ways, help the very problem you guys are talking about right here, which is these encounters with police that sometimes become really unfortunate. And so we're working in the transportation work group to come to create these workflows, and also to create the rules, Oregon administrative rules, et cetera, that will support this new workflow. Then we have several work groups creating the care models. So it's kind of like you come in, then there's what happens while individuals are actually receiving care. And we have been quite inclusive of, like Sharon said, in all of these bodies of work, of staff from all of our participating organizations, staff from other organizations that we exchange a lot of information and, of course, continuity of care for individuals, and also peers and advocates that we have invited to the table, which really always changes the conversation, and as far as I'm concerned, to the better. And then, so you have the care model design. We are now in the midst of doing a lot of care model design. And then there is what happens after, which is what we are calling the transitions of care work groups. And I mentioned the cabinet, and there are 3 transitions of care sub-work groups, if you will, for adolescents, for adults, and for minorities that we're addressing separately, but then bringing it together to integrate that into a larger recommendation to the cabinet and to our funders as well. Because of course people need to pay for that, those services. So I guess I'll stop now and just chat with you guys.
So do we have any questions from the COAB? Sharon?
So I'd like to tell the doctor thank you for presenting that. It's really good to hear, because just thinking about how the police have had to respond within the city to dealing with mental health and people who have addictive behaviors, folks have really been terrorized and brutalized instead of helped. So this is a good start, and so really looking forward to seeing the change of how Portland Police is going to execute and implement on how they do their policing as we move forward. Thank you.
Yeah, and thank you for that. And we're slated to open at the end of next year. We have still a lot of work to do, both in terms of designing all of these workflows, but also the construction inside the building. We are gutting the entire building and making it all new.
And just to follow up on that, just in regards to with the Obamacare, the fact that so many people did not have insurance or health services, is that going to be tied in on how care is now happening, and as far as people getting the mental health services that they need, so the police are not responding to real social issues versus a person is actually committing crime but they're sick? I'm just curious on this center and how that all is being connected.
Yeah, and I think what I'm hearing you say is that we have a lot more people with access to care, and so we should see an improvement.
Yes.
I agree with you, and at the same time, I have concerns because we have had an influx of individuals that now are seeking care in community-based organizations and hospitals, and the system is pretty much like clogged. You try to get a session with a psychiatrist, and it takes 8 weeks. So there's a lot of work to be done. I think, yes, it's better because people have more access, but oh my gosh, the access is not there because it's still catching up with the number of individuals accessing service.
Thank you.
Okay, so my stack says Abel, V, and then Tom, then Philip.
Thank you, and thank you very much for your presentation. I have, I think, 3 questions.
Oops, I better take notes.
The Veterans Administration is not a part of the collaborative of...
The what? I'm sorry?
Veterans Administration, VA.
No.
So what if a mental health crisis involves a veteran?
Yeah.
That's one question. Do you want to take them one at a time, or do you want me to?
Well, I can try my best. We already treat vets at our systems, and in fact, it's a challenge sometimes, the transition of care, because it is limited what's offered. But what I want to say is that we are actually going to be bringing their medical director to our discussion as well, to be facilitating transitions of care and to be able to do the best we can for that population.
Okay. And then what have you learned about working effectively with racial and ethnic populations, people of color populations? I heard your reference to minorities, and I'd need to hear more from you about what minorities means, given the shifting demographics of our community. But again, the question is, what have you learned?
Yeah, well, I'm a Latina, and so it starts right there, and then I have a past of working with Latino population. But, well, I think what I have learned from my own experience is the importance of actually having everybody at the table and asking questions and seeing what people need and not assuming. That's sort of like, so Unity Center will have an advisory council, a community advisory council, that we're trying to be very careful in inviting representation from different communities of color, also gender differences, etc., to be able to get that input. But that we don't want to stop there. Legacy has an incredible diversity advisory council that I'm part of, and we're very committed in every single step of what Legacy does to actually increase the minority in our leadership. We have policies that actually are followed in that to increase minorities in even the purchasing that we do, the contracting that we do, and all of those aspects. So, I mean, I'm not an expert, by no means, and I think I will continue to learn.
I appreciate your response. And just one last comment, a recommendation. There's an organization, the Alliance of Culturally Specific Behavioral Health Providers.
They're at the table.
All right, that's great. I'm so glad to hear that.
Yeah, they are actually running our minority / diversity work group. Holden is running it.
Excellent.
So, yeah.
Excellent. Thank you.
You're welcome.
V.
Yes, thank you for joining us, Dr. Ferrantino. I appreciate your time. I have two specific questions. So, what does the drop-off center look like, and how would that function for the PPB? One of the concerns I have, because we now have one location as opposed to 4, so immediately my mind goes to, well, that means that there's going to be two things. One, the PPB officers will be spending more time transporting people, certainly if they pick up somebody way out towards the Tigard-Portland boundary area, it's going to take them, 23 minutes or something, depending on what time of the day it is. And then two, how long will the officers be able to drop off the person that's experiencing a mental health crisis and then leave? Or are they going to have to stay there?
Can I start answering? Because otherwise I'm going to start losing my mind.
Whatever you're comfortable with doing is.
Because otherwise I'll forget.
Oh.
So, I'm sorry. It's just, I'm sure all of you are just feeling just like me. It's like,
You're fine.
so, if we realize the vision, police officers will not be dropping off individuals there. Police officers will be calling ambulances in the field and transferring the police officer custody to the ambulance. And then individuals in a crisis will be transported to our facility by ambulance. That's not to say that if a police officer decides to come, that they cannot come. They can. It's an EMTALA facility, and that means it's open to everybody, and we don't refuse care to anybody based on any kind of criteria. But wouldn't the world be better if you didn't have the police officer transporting that individual?
Yes. Okay, so second question. I hear you saying that it has a walk-in center, and for people with lived experience, I think that can mean a whole variety of things. It can cover a spectrum of varieties. Can you explain a little bit more explicitly, because I couldn't suss out what that looks like and how that might operate for somebody who is in a crisis?
Yeah, so I'm going to be very honest with you. I don't know 100% how it's going to look like, but I'm going to tell you a few models that we've seen and some that we will see that may inform it, in addition to the people that are participating in the planning process. So Centerstone is a model. I don't know if you know, have you been there? So Centerstone, it's a model that we have here, that it's staffed by mental health therapists and peer support specialists, also has a nurse practitioner, et cetera, and has that kind of environment. I'm going to Arizona to visit this place called Recovery Innovations that has created the original, I guess, living room model. We want to learn and check out what is it that they're doing. But in principle, what's a place that a person that it's in crisis wants to go? I mean, it's a place where you come in, you're welcome, that you're not judged, that maybe you get a blanket or maybe get some tea, and that you can talk to someone and figure out what's your next step. And we're incorporating ideas as we go along. For instance, one of the ideas in one of the workshops that we did is that instead of having receptionists, we could have peers that were receptionists, and that would actually be checking people in and already sort of kind of making them feel good, feel okay, it's going to be fine. You know, there is recovery. That's the idea. Now, I don't know yet how it's going to really look. And by the way, we're going to open and we're going to learn after we open. And we're going to be learning as we go along. This will be a learning organization.
Thank you.
Thanks.
My next person is Tom.
Thank you. 2 questions. And my questions are not meant to comment on the quality of the plan or what you envision. But I've heard some concerns or criticisms from the community that the beds that you're going to consolidate in one facility really represent the same number of beds that currently exist, give or take. Is that a correct concern?
It's actually worse because it's a drop in the adult beds. Now, why is that? It's because it's what fits inside the building. But why did we think that we could do that? It's because if I show you our data, about 25% of the inpatient hospitalizations today are 24 hours. We're going to have now a psychiatric emergency service that has 35 recliners that will be there 24/7 to help individuals that within those 24 hours, either because their hold was dropped or because they are voluntary and they decided to leave, or because they just resolved and they want to go home. So we feel that we will be able to manage, but it's not ideal. You're absolutely correct about that. It is not ideal. It's what fits in the building.
Well, the follow-up question then is, with the drop in beds and with whatever way you're going to handle the need, is there a needs assessment that tells you that you need 500 beds, or have you done that sort of work?
Well, there is a need assessment going on right now that actually the parent company that owns Cedar Hills is doing, mostly around geriatric beds, because there is a huge need for geriatric beds. When we conducted our research before we went into this, we also contracted with Horizon, which is a consulting company that did an assessment, and everybody agrees that we could have more beds. You're perfectly correct about that. The reality is that this was the constraints that we had to work with. The other thing is, I'm going to be very honest with you guys here. hospitals are not dying to have behavioral health beds because it's a money-losing proposition. So all hospitals lose money with behavioral health. I'm not saying that this is good or beautiful or anything. I'm just sharing with you how it is. So I think the premise that we have, that it's that I think is a positive one, is that many of the patients today that are occupying beds are patients that discharge in 24 hours, 24 to 48 hours, and that we feel that this is a new model that will address some of the needs of these individuals with this new model of care.
Thank you.
Okay, Philip is next, then Laquita. Yeah.
Particular question and comment. Is that okay, Philip?
Yeah, that's fine.
So just to respond to that as well, one of the real crisis that we face, and it's getting a little off topic, but the crisis that we see in the emergency departments is individuals boarding for days to weeks that are there in the windowless room, in their, sitting in paper scrubs in the most traumatic, horrible environment possible, not getting treatment of any kind, not getting really great care at all. And so that's what the situation is right now with the number of beds that we have. Many of those individuals, if they just had a psychiatrist that was right there that saw them as soon as they came in, a social worker, a case manager, nurse practitioner, they would be able to leave that day. But because we don't have the capability to make that, instigate the treatment right away, people stay there and languish. I mean, that is the situation currently. What they've shown with this the model that the Unity Center is based on, and that the Unity Center, I think, will learn from the challenges and mistakes made by the prototype in Alameda. But even within that, even if it's a flawed model, that model showed that 75% of the people that came in were able to be discharged within 24 hours. So that decreases just the baseline need for those beds up front. In addition, the care that individuals receive by going to a dedicated psychiatric emergency department where people are know how to treat individuals in mental health crisis and have an environment that's conducive to that treatment is so much more beneficial than what is faced now, which is it's hard to get worse. I mean, it's possible, but it's tough. And so the actual care is better, whether they're inpatient or whether they're in the psychiatric emergency services portion. And the relative number of beds, actually, given the decrease in the need for them, is proportionally, it's greater than actually just having that same number, all other things being equal.
Okay. I want to say something right here about time.
Sorry.
We're in danger of tabling once again something that's been on our agenda for the last 2 meetings. So I would encourage people to be brief, to not repeat, ask questions, let's get the answers, and let's move on. Okay, Philip is the next person up.
Okay, I've got 3 questions. First, thank you for coming tonight and presenting to all of us, and your work has been great. It's been wonderful seeing the improvement for the community with that. So it's very exciting. 3 questions I have. My first is, I'm just wondering what your plan is for the future once you open and establish it. How are you going to document the data that you get, or how do you plan to do the statistics to show what the needs are and to continue those services? What is your documentation plan for that? That's my first question.
Okay, so we actually, this will be one of the advantages of having a center that it's more centralized, a hub, it's because we will have an incredible amount of data. We use an electronic medical record and data center called EPIC that it's the most robust that exists, and that can extract just about anything that we want: recidivism rates, rehospitalization rates, satisfaction rates, where people go after, do they follow up in their appointments, et cetera, et cetera, et cetera. I mean, there's just the incredible amount of data that we will have to manage improvement processes, because like I said, we're going to open and we're going to have to continue to learn with the experience and with the data.
Okay, thank you. And second question then. So once you have, or do you have a policy or some kind of decision on how you're going to address if there's a conflict between an officer and a person experiencing a mental health crisis? For example, a person in a mental health crisis who's addicted, a drug addict as well, that's a legal activity. So where is the line for that? They shouldn't be put in jail, but the police might want to follow up with that person after the mental health crisis, because that is a crime. So I'm just wondering how you might address that issue.
Yeah, and that's a great question, because we run into dilemmas between where do people belong. Several times a month, we have these dilemmas of somebody that is so ill that it's committing crimes. They don't belong in jail, believe me. And they come to our care, and then sometimes they are out of control. They are ill, and they punch somebody in the face, and then the police come. And so it's a push and pull. And so I think this demands the same kind of work that you are doing here and that we're trying to do in our endeavor, which is the community together, discussing cases, discussing situations, and trying to come up with better solutions, because we have a very siloed system in which the civil commitment and civil procedures don't meet the criminal. And so sometimes you have a person with both issues, and if they are in the wrong place, they are really, in a bad space.
Okay, and my third and final question then. I guess I'm not sure how to phrase this question, so I'm just going to give an example. In Northwest on 3rd and Davis, there's a police station right there, and there was a woman outside who I saw. I see that person every day. I live downtown. I walk the area, and so that person clearly has a mental health issue, and was walking around and would lie down on the street, and it's naked in front of the police station. And so I was just wondering, when your Unity Center is established, are you going to develop some kind of guidelines for the police to require a response to put a person like that, or ignore them and walk around them and lay on the street and just let them hallucinate and be there? What is your thought on that?
That's a very good point. I think I cannot speak for the police. I think I can speak for what I think morally is correct. But what's the extent that we will be able to influence police behavior? I think we want to influence the transportation of the police, of what police does today, because we think it's actually a pretty good deal for everybody. But I think, to your point, I think this is something that perhaps this group here can have more influence insofar creating those dialogues with what's the correct answer to that kind of crisis that's developing right there.
Okay, thank you.
Thank you.
Laquita, you had your hand up? You got your question answered, okay. Sharon? I'm sorry, Jakari. Jakari. You had,
Wanted to answer Phil's question about if someone's had like a drug overdose or anything like that. It's just a medical. We can't charge anyone for having drugs in their system, nor do we. So they just go to the hospital. We don't. Yeah. I was curious on if someone wants to, let's say the person that's laying on the street, and they're in clear crisis. Someone calls and we do a welfare check, and we're able to get them to want to check them into the hospital. Is that what you guys take as just voluntary patients, or do you take mental hold as well?
All comers.
All comers.
All comers.
Okay. And then with mental holds, how would that work with your model here? Would that be where the paramedics would write the hold, or would Project Response still do that, and then
Project Response. So
paramedics
it will be
transport?
kind of sort of how it is today, with the difference that the police officer hold will be able to be transferred as a transport hold to the ambulance, so the ambulance can actually transport the individual in crisis. But Project Respond, it will continue to function the same way. We're working out the details. There's a lot of details that go into what you just said in terms of how exactly is going to work out. We will have more opportunity for input and public comment as well when the rule committee starts making the rule for this extension of, no, it's not an, I don't even know, I guess it's a transfer of the police officer hold. And we will have a rulemaking and a rulemaking committee, and people will be invited to the table to also be able to comment on that. The devil is in the detail, so we are working through that.
Okay, yeah, that's just where I found these incidents when they get out of hand, or in these details.
Exactly.
And then another question was, with your facility, would you guys have your own security where if a patient became violent, we would not need to respond? That would just be an in-house?
Yeah, it's just like we have at Legacy right now. We have our own security. That it's not, they are not officers, they are security for the hospital, and very seldom do we actually have to call the police to come in.
A lot of facilities we do get called into, they'll shut down, they'll go into lockdown mode, and then we'll have to go in. And so, and a lot of places like that do not have their own security. So, like I said, these are kind of the things that I've seen where there's kind of like that breakdown. So I was just curious on how you guys were going to work through that.
Yeah, we will have our own security staff, just like we already have. But we are actually looking into really transforming the way they are. We are even looking at different uniforms to be much less like security and much more like hospitality and problem solving. So anyway, those are some of the ideas.
Thank you.
okay, we've got Sharon and Abel and Laquita. And, Okay. All right, push me on the time, why don't you? Okay, so Sharon, you had a question?
So, again, those 4 partners you said were OSHU, Legacy, and who were the other 2?
Adventist and Kaiser.
Okay. What is the county also a partner in this?
Not of the business. I think in a way we are all in this together as a community, and the county is really at this point a payer. They are a payer because they hold the mental health dollars, and they have the contracts and they pay for services. So in that sense, they are a partner, but they are not part of, this isn't a county facility. Does that make sense?
Yes, thank you.
Okay. I've got Abel, I've got Laquita, and I've got V. Oh, I'm sorry. Alicia. Abel, Alicia, Laquita, and V.
Then what is it?
It's a private, it's a non-for-profit, private organization. It's part of Legacy. In fact, it's going to be a service of Emmanuel.
Okay, I think it's important to get that piece on the record.
Okay, on the record.
Yeah.
It's
Because
not a county facility.
Okay, two questions. Are you consulting with Disability Rights Oregon around the design and development?
Yeah, we have
and
had them
capacity?
participate in several of our conversations.
Are they at the table, the planning table?
They are.
Okay. And then I'd like to hear more, you talked about uniforms and hospitality, and that leads me to ask what values and principles will guide the development of the Unity Center, but be reflected in how people are treated within the Unity Center. And so if there is a statement that you all are working from that is a reflection of values, principles, I'd like to see that as well. And I think I'm coming from a place of being a little nervous about all of the dollars and cents involved. They are taxpayer dollars, but we're talking about dollars that are in the hands of private entities who are money-making businesses. And so I'll just leave it there. I would like to know more about the guiding principles and values.
Yeah, and to speak to that, I would really want to have my documentation, you know, the documents that actually
Sure.
can support, because we worked a lot in it, and we put a lot of effort into it, and so I don't want to misconstrue. I can just speak to you that in more like high-level general terms, that to being patient-centered, considering the family as part of the customer that we're caring for, family and support system, a place of hospitality, a place of hope, a place of recovery, a door to recovery, and a place of relentless pursuit of well-being. Those are some that I can come up right now in my brain.
That's helpful.
Yeah, and the other thing I want to just say, I mean, for what's worth, the build of the facility is going to cost $40 million. That's mostly coming out of private donations. The county contributed $3 million. The city contributed $500,000. Washington, the county, when I said the county, is Multnomah County. And then the other two counties contributed $250,000 and $200,000 each one. So the majority of the money that it's being put there is by philanthropic individuals in our community. And some of it is legacy money. So just so you know.
Thank you very much.
Alicia.
I think sometimes we lose track of the things that we actually have worked on. So probably about 4 or 5 months ago, the mental health subcommittee crisis, or the mental health sub.
Excuse me, just a minute. Hold on.
Can you hear?
That mic doesn't seem to.
Oh, this one's not working?
Doesn't seem to be.
Philip, we're going to get intimate here. Thank you. So I just wanted to draw our attention to about 4 or 5 months ago, the Mental Health Crisis Response Subcommittee worked on mental health directives for the Portland Police Bureau. And we actually pored over those directives, and we discussed specific things and made specific recommendations that are actually consistent with some of the things that Dr. Ferrantinos is sharing today about transportation, who should be transporting folks, about mental health treatment drop-offs. So I would encourage everyone to go back. All of this should be on the record. Take a look at those the mental health directives that we all poured over and made specific recommendations to that actually does relate a lot to this. And what I would also add is, Dr. Ferrantinos, it might be helpful for you and your team to take a look at those mental health directives as well, as it might inform your process, and then as you change through the process of time. I'm getting a lot of feedback here. Okay. Can everybody hear me? Okay. Okay, great, thank you. So that through the process of time as well, that perhaps we can make some adjustments and then maybe go back and make some different recommendations based on what is and not what we think will be. So I just want to remind that we actually have been doing a lot of that work. And to Philip's point in question, who's going to be making those types of recommendations? Well, I'm saying we are, and we have, and will continue to. Thank you.
Laquita, then V.
Everyone answer my questions before I get to it. So I'm thankful for that. And but I do remember a few, like maybe last year, Doctor, if this is correct, ex-state attorney Amanda Marshall proposed that the psychiatric hospital be in place per prior. What'd you say, Michelle? Yeah, prior the state DOJ settlement. So that's what I remember reading early. So there are some articles that are out there that I had remember reading this information prior to this becoming in existence, or like where we are at right now on that project. So where you guys are at. So like, but my questions got answered. But what I gathered from that maybe several months ago is that it was a recommendation from the state to have this happen.
You mean, let me see if I'm hearing what you're saying. You're saying that we are building this facility because the state recommended? Yes. Well, not really. Actually, it kind of happened in a parallel way, but we're very pleased that I think this facility will meet some of the requirements of what our community needs. And our community needs it to even much more of a larger population that is not just the ones that are transported by police. I mean, we will be serving, 50 individuals a day in the psychiatric emergency service and 101 beds. I mean, it's a much larger community that we'll be serving. But in a way, it was a parallel process. The DOJ folks actually came and talked to us and asked us what we were up to, and we told them, and they said, good, that's good, that's it.
Okay, V, you're next.
So, real quick, I'm not trying to put you on the hot spot. And it's fine if you don't know. One of the concerns that I have for our community is whether or not the CATC will.
Oh, no.
Okay.
No.
So the reason why I asked, to inform everybody that missed that invisible sentence, is I thought that the CATC was going to be gone.
No.
Right? Because the mayor, gave you all.
Not that I know of.
500,000.
And they come from different
Do
pots
they?
of money. Yeah.
That's great to hear that.
Yeah, that I don't think so.
Okay.
In fact, we cannot function. I think an acute care facility needs a subacute care facility because the patients need that transition. I mean, there are individuals that don't need to be in acute care, they need to be in subacute care. And by the way, we're going to work very closely with CATC because their motto is pretty good.
With who? Oh, with CATC?
CATC,
Okay.
yeah, telecare. And we're going to work pretty closely with telecare to actually get the best of their motto in the Unity Center.
Thank you.
Okay.
And thank you for coming.
Thank you.
Any other pressing, urgent questions? Abel?
There are two Department of Justice investigations and settlements. There's the one that involves the Portland Police Bureau, City of Portland. And then there's the other investigation that was of the state hospital and the state's mental health
On the
system.
side, yeah.
So there is there's a parallel piece that we should be looking at, and keep asking questions about as well. There is a nexus, is what I'm saying.
Yeah.
Very good. Thank you.
Okay. So, now, I will. Thank you for being here. Thank you for your presentation. Thank you for answering all the questions.
Thank you for having me.
What I'd like to do now is invite people who have signed up for public testimony to come forward, and especially if you have something to say about the presentation that was there. I have on my list Barbara Ross and Nancy Newell.
Thank you. My name is Barbara Ross, and in a previous life, I was once a mental health director, so I am so pleased to see this kind of progress and this kind of compassionate and effective approach to people in mental health crisis, and I'm really delighted with this. What I wanted to say tonight is that this police accountability publication that some of our volunteers tried to give to you a few meetings back, and the city attorney said this was a gift and you couldn't receive it. I think that that's a really good book, and it's really pertinent to your task because it talks about police reform. And I've read the whole book, and I found it scholarly, accurate, but at the same time readable. And it really speaks to efforts to reform police all over the country, including dealing with people who are in mental health crisis and people who are victims of addiction. And so I think it's really important that we figure out a way that you, as members of this committee, can get access, even if you don't read the whole thing. If you skim pieces of it and then read the pieces that you think are important, it gives you a flavor for the importance of citizen oversight in the police law enforcement reforms across the country. And one of the things that stands out is that when there's a crisis, when there's a tragedy, people get really excited, and the administration says, we're never going to let this happen again. We're going to have new training. We're going to have new procedures. And then if the fervor on that fades out, then the care and the treatment of victims falls apart. And I'd like to call your attention to the fact that where our city auditor produced an audit on training in a police bureau, and it was released earlier this year, and tragically, we are repeating that same cycle. That the Aaron Campbell case made the police administration and citizens very upset about the killing of an unarmed black person. And there were new directives, and there was a new set of training on de-escalation. And in 2013, there was extensive training included on de-escalation techniques in our police department. However, when the auditor went back and sat in on the training in 2014, the training on de-escalation had been reduced to 20 minutes. And when the trainers were asked why this happened, they said, well, we don't have enough money to cover everything, and we already did de-escalation, we don't need to do it again. So I think that looking at that auditor's report is available, and I think it really emphasizes the importance of citizen oversight in making sure that the techniques, the responses to tragedy, are continued and that changes in training continue over time and are not just temporary things that then fall under the bus. Thank you very much.
Thank you. Okay, I have Nancy Newell.
Yes, I'm going to try to limit my time here so I can give some time to someone I consider quite experienced. I've had plenty of experience in my family with mental illness. And my mother was city treasurer, and she was also subject to treatment that shouldn't have occurred. And, you know, this presentation is great, but it does not solve the problem of police mischaracterizing an individual or handling it completely wrong. And this is a serious problem. That's why we're here, for the settlement. We got to get right to the source. We got to get right to the instant that decisions are made, the person is calling and describing what's happening so that there isn't misguidance and the mentally ill are being shot to death like these parents' son. That's what happened to him. He called for help. He called for mental health help, and he was shot to death. So that's what we got to look at, but I think we have a person here, Christy, 20 years of experience. She can really fill us in, and I hope you can give her some of my time. Thank you.
Thank you, Nancy. I have Christy Jameson as the next person who is up to speak. And after that will be Joe Walsh.
Thank you. And again, for those that may or may not remember, a former co-op member, but I'd like to correct the chair, Chair Feudalis, from previous statement about the reasons or that persons with mental illness haven't been discriminated or didn't leave the COAB because of their mental illness. First of all, I was never ever contacted by anybody on the COAB, including the chair, about that, so that's probably not a statement you want to stand by. But the most important thing is that, and the chair of the Portland Commission on Disability, LaVon Heister, is here present, so she can respond to this. And I would encourage her to do so. But what I'll tell you is that Commissioner Amanda Fritz is also here, and she is responsible for the seat, the formation of the COAB, which included the Human Rights Commission appointee and the Portland Commission on Disability appointee. She was a strong advocate, and that was really important. What you may not understand, which is what I'm challenging your statement, is that it's the only two seats or appointments on the COAB that is directly tied to being on those other commissions. So if you're no longer on those, then you can no longer serve on the COAB. So none of your appointments are tied to anything else. So just be clear about that. But what I want to talk to you about today, I was inspired to come tonight to address Dr. Ferrantino's, what I'll say is basically sort of a public relations and marketing campaign. The Unity Center has nothing to do with the settlement agreement. This is a substantial waste of the time here on the COAB. There are many other opportunities and lots of public forums that she's going to be at, and you could have attended to not waste our time. And the reason why I'm making such a strong statement is because and I wish Sam Adams was here, and I hope that he can come at some point. He's very busy, obviously, as you know. But when in the settlement agreement, there's a walk-in drop-off center. I went to see Dr. Ferrantino's 10 months ago. We've had subsequent chatter, but I went to see her in person, and one of the things that I said to her is that I asked her if she was familiar with the settlement agreement, in particular about the walk-in and drop-off center, and she said she was sort of cursory knowledge about it, not totally familiar. But I said, here's what I'm concerned about. The COAB is about to be formed, we're going forward with this. The COAB is about to be formed, and here's what's going to happen. For persons with, as far as the persons with lived experience of the mental health community is concerned, the only real justice in the settlement agreement that is desperately flawed is the walk-in and drop-off center, and it just so happens to be the only part of the settlement agreement that is not enforceable. All the other items are enforceable. So in this case, I said what I'm concerned about, what your efforts are and what your vision is to do this, is that it's going to be a distraction, and I don't want those things to collide. because the walk-on and drop-off center is a very important element, and that should be your focus. It's important to be knowledgeable about community-based services and things that are happening, that Olmsted is still being violated, that the Department of Justice is also looking at the state, all kinds of services, which is excellent, and obviously Adrienne Brown will go into detail about, but it isn't anything to do with the settlement agreement. The walk-in and drop-off center is a place for the police that was similar to, in 2000, I was involved in closing the Providence Crisis Triage Center. And that was a significant resource, desperately flawed, lots of problems, we needed to close it. But in the interim time, or the intervening time, the 3 police chiefs and lots of folks have been involved wanting something like that back, where there was a place that the police could drop people off, that it was a diversion to jail, that it wasn't hospitalization per se, that there were some other aspects to it. And the Unity Center is one of the, there's 3 things that were, I think you maybe not, or that I want to emphasize. First of all, it is going to be such a tiny percentage of people that the police will relinquish, take off handcuffs. I mean, think about this rationally. That'll actually undo handcuffs and put it in the back of an ambulance to get to the Unity Center. A tiny percentage. So be clear about that. But I want to tell you about a group, because I don't, in the interest of time, I don't know how much time I have left. But starting about this time last year, in anticipation for that the settlement agreement would be approved pre the fairness hearings, all that stuff that happened last February, or more than a year ago, is that myself and mental health advocates, lots of mental health advocates, city officials, and the Housing Bureau, the Housing Authority of Portland, of course they are called something else now.
Christy,
Home
I
Forward.
have added Nancy's time to yours, and I'll give you another minute, okay?
Thank you. So that we added, or basically we met in City Hall and we designed including down to the financing, down to every little aspect of the walk-in and drop-off center. Right before the fairness hearing in February of 2014, Gail Shibley, who was the former chief of staff of Mayor Hales, cut it off and said, you can't meet anymore. The city is no longer supporting or endorsing or going to provide our effort, space, time, resources to develop the walk-in and drop-off center because it is not, because they recognized that it wasn't enforceable. So you'll notice that everything, and I'm sure Tom can confer with this or reinforce this, is that what you'll notice is that when the city talks about on Mayor Hales, when the fairness hearing happened, you started hearing the phrase aspirational, thank you. And that's what it's connected to the walk-in and drop-off center. The Unity Center it's not a real advantage to the community, but I have criticisms of it that are separate and apart from this. But I want you to be not distracted, that the walk-in and drop-off center still needs to be developed, and that this is something that should be your focus.
Okay, thank you. Yes.
Can I just ask a question? Sure. Or a couple of questions. Thank you for providing some of that background. And I don't know all of that history at all. To a question and a comment. First of all, is there a reason that why could this facility not, if people in the community work in concert, why would this not fit the criteria of a walk-in drop-off center? What is it that wouldn't fit the criteria, or that couldn't be worked on to meet those criteria?
So thank you. So I'll answer that in 2 ways. So this is what I tell Dr. Ferentinos and my nasty grams to her, is that this is not, how does this affect housing, sandwiches, socks, friends? It doesn't affect any of that. so when people go to the Unity Center, the crisis has already happened. We need to focus on prevention. This is a grotesque diversion of resources that don't exist.
So, but a drop-off center suggests
so
that
the
a
police
crisis-
officers, one of the other things that you guys need to focus on too is that there are a lot of rules about how the police officers can enter a facility with their gun, weapons, all that stuff.
Yeah.
Okay, that's fine. I'm just saying that that would be a more useful conversation than this.
And we do that, and it's directly related.
Okay.
So the other part of it
Did
is
you
that
get your question answered?
Yeah, but I did also want to say in terms of how many, you raised the question.
It reduces bed space, and also the Crisis Assessment Triage Center I was also involved with that. I was also involved in starting Centerstone, which are both failed projects basically, and it's going to happen again. The other part of it is that the state is going to lose substantial funding if this House and Senate bill, the Murphy bill, goes through. Medicaid, how they reimburse a Unity Center type
Right.
thing is going to be a problem.
My question, though, is actually, you had mentioned the other thing that directly relates to police and bringing individuals to the Unity Center or the transport to the Unity Center. You said how many times are police going to be taking off handcuffs and putting people in the back of an ambulance? And the answer is all the time. In Alameda County, which is 9 million people, in a county not unlike Multnomah County, but just a lot bigger, virtually no one is transported via police for a mental health crisis or a perceived mental health crisis. So
Well, that's a substantial
there's-
culture shift.
Okay.
With all due
I
respect,
need
Dr.
to-
Marin, what I'll say,
I need
just
to
final
We
comment.
can have a
something with this
conversation later,
discussion
but-
at
Well,
this point.
go
Maybe-
see the CATSI and find with the police bureau and ask them how many times that they're able to go.
That's
Okay.
the past. We're looking at future.
What I'd like to
It's
do
still
right now
funded.
is move on to the next speaker. The next person who wants input, that's Joe Walsh, and then Dan Handelman. And remember, you have 3 minutes. Okay, Joe. I won't start the clock till you get there.
My name is Joe Walsh. I represent Individuals for Justice. And for you who spoke up about the volunteers getting stipends, please continue your fight. We will continue the fight outside of this group to make sure everybody that attends these meetings are reimbursed. I'm looking at a man who is making some bucks. The chairperson of this committee is making some bucks. The volunteers should get stipends at every meeting that you address. Subcommittees also, you should get stipends. You should not be losing your money. This thing is gonna go for 5 years. And now the chairperson announces you're going to have to meet twice a month. Pay them, lady! This morning I had an interesting conversation with somebody you know, Judge Michael Simon. I was on a conference call with him because they excluded me from the entire building called City Hall. And I don't think the mayor has the authority to do it. And the judge granted me 3 things: to go right to the merits of the case, to waive all the fees, and let me do it pro se. And the question is, can a mayor, on his own authority, bar somebody from a public building that holds hearings that have nothing to do with him? That's the question. First Amendment says no. Interesting. I bring this up not as a tangent, but to say to you, you have another problem. And I'm beginning to believe, as a critic of the police department, that they are victims of this system too. Different victims, than me, and different victims to you, but victims nevertheless. And it is the politicians that think they are dictators that say the policy, you can change this officer, you have to go to the mayor. You have to go to the city council. You have to say to the politicians, this system systemically is corrupt. That's the problem. It is not the police department. And I know I'm going to get in trouble on this one because I'm a big critic of the police department.
Joe, your time's up.
But I think they're victims. I waited 2 hours and I decide when it's over. It is over.
Thank you, Joe. Thank you very much. Dan Handelman, and then Ann Brayfield, and then Shelley Hall.
Hi, good evening. I'm Dan Handelman with Portland Cop Watch, and we appreciated a couple of mentions of our group already tonight. On that note, though, I want to say a few names that come to mind when we're talking about this psychiatric facility: James Chassie, Keaton Otis, and Jose Mejia Put, who was brought to a psychiatric facility but didn't have a psychiatric problem. He had epilepsy. Aaron Campbell's name already came up, but he also was in mental health crisis when he was killed. I think it would be helpful for us. We got all these sheets of paper out on the front table that have your different subcommittees on them. It would be either helpful to have all the information on one sheet about who's on which committee, or for our projector, which I think this room has one, to put all that information up on the screen while we're having the meeting so we know who you're talking about when you say this committee and that committee. It also occurs to me that that board there behind you has the list of all the mission statement of this group, and the one that didn't get read is that you're supposed to take public comment. So that is, I'm very glad that the mission statement was read, but I just want to make sure we don't lose that important piece of it because that's what we're doing now. We're giving our public comment. Some comments were made that I had a little concern about, saying that the emergency room might be the worst situation a person can be in. I think a jail cell might be worse, especially if a person is stripped of their clothing, as often happens, or shackled to the floor, which happens. When we talk about the centerpiece of the settlement agreement, the centerpiece of the settlement agreement is use of force. It is particularly use of force against people with mental health issues. So I really don't want us pitting communities against each other by saying any one community's concerns about use of force are more important than others. It is true that mental health community is particularly talked about in the agreement, and it needs special attention. But we should make sure that the use of force stays at the center of the discussions. When people use the first names of bureau members and say Captain Mike or something like that, it's not helpful for us in the public that aren't on the first name basis with everybody. It'd be helpful if you can use the last names. It was curious that the week after your last meeting, there was a discussion at City Council about the funding for this body and for the people who run the COCL team, and there was no mention of that at the meeting. It came up on the City Council agenda, which popped up the very next afternoon. A couple of your members were there to attend, but I think you could have discussed if you wanted to have something to say as a body, if somebody had let you know that was coming up. And in terms of this, the running of this meeting, it's helpful if we, the audience, knows what time each section is supposed to end, and maybe if all of you know what time the section is supposed to end, and then you know how to tell your comments so that maybe we can keep it on track. And I've noticed in the past that the breaks tend to run longer than they're supposed to, so I'm hoping that doesn't happen tonight. Thank you.
Ann Brayfield, and then Kelly Hall, or Shelley Hall. Oh.
Hi, my name is Brad Taylor. I'll be reading comments from Ann Brayfield, who cannot be here this evening. Good evening. I am Ann Brayfield, concerned citizen.
I'm sorry.
That was fast.
Okay. Go ahead, Brad.
Good evening. I am Ann Brayfield, concerned citizen. The good news this week is that this meeting is now being live streamed. This is a step forward in community engagement that you know is addressed in the settlement agreement, that as you know is addressed in the settlement agreement. The continuing challenge as to community engagement is the timely availability of subcommittee and work group agendas and minutes. It is reasonable for citizens to expect to be able to go to the COCOL COAB website and find these items readily and timely available. Accessibility to subcommittee and work group meetings for citizens to be able to be present and participate in this important work when they are unable to be present in person is critical for community engagement and for adding willing workers to this process, which appears to be overtaxed. The Accountability Subcommittee made a positive start this past week with teleconferencing and will be looking into video conferencing through Skype or Google Hangout. Video conferencing is preferred as it makes it much easier to follow a meeting and to participate. These items have been brought to the COCOL's attention, and it is my understanding that questions raised concerning the above items will be responded to by the COCOL next week. A response is welcome. It is my hope that the Community Engagement and Outreach Plan Subcommittee will also address these issues of community engagement as they make their recommendations in the areas of community engagement that they are addressing. Thank you.
Thank you, Brett. Shelley Hall?
Okay. My question is, my son was shot 3 years ago. He would have been 25 years old on Monday. He was depressed. He had just lost his grandmother, and then he loses his life within 3 months. I have his little boy, which is my grandson. He will never know his dad. So how are you going to show us that you're going to help the mentally ill and the depression that they have? There's no way. If you're going to go and shoot someone that's on a roof without waiting for response team to come out and help that person, you're taking my only son away from me. I have a daughter, but not my son. And that's why I'm disappointed in our system.
Thank you. I've got Adrian Brown, I think, is next.
Good evening. Thank you, everyone, for having me today and for all the public comment that's been received so far. First of all, just on a lighter note, I feel your pain about the stipend, okay? None of us are getting paid here after 5 o'clock, including federal DOJ folks. Our pay ends after 5 as well, and I've been on this case for 5 years already. But public service is a higher calling. We don't do it to get paid. And so I appreciate all the public service that everyone here is doing for this, including the public service of the community members, because I know I've seen many of you at other community meetings. So I just want to thank you for your service, and I appreciate that it's tough. I wanted to address specifically and provide you a little bit more information about the other investigation that was alluded to by a couple of the members here regarding the state's requirement to provide community-based mental health services. As you know, I'm an attorney on this case, but I'm also an attorney on that case, which dovetails very nicely because of the overlapping issues regarding mental health. And in regards to that case, that is a statewide case in which we are investigating the state pursuant to Title II of the ADA, which requires a state, to the extent that it provides services to individuals, that it requires a state to provide those services with individuals with disabilities in the most integrated setting possible to meet those individuals' needs. And so to the extent that the state provides mental health services, that integration mandate, which was affirmed by Olmstead, which is a Supreme Court decision that some of you referenced, the state is required to provide those services in the most integrated setting that fits the individual's needs. And so that raises the concern that both the doctors raised about ER boarding and the concern surrounding the need for psychiatric emergency services. So in regards to that investigation, we have both likes and dislikes about the Unity Center. I know Dr. Ferrantino's mentioned that we felt that it was all good, and for the large part, for this case, that's true. We are very happy to see that there is a downstairs, what we're calling the downstairs model, which will integrate the community-based services to link people as they exit the hospital, as they get stabilized. But I also, to Christy Jamison's point, recognize that, the upstairs, the 79 adult beds, is not part of this case. Okay, the adult beds is where someone would go if they cannot be stabilized. And that's not part of your case here. And that is a concern of the state DOJ case. And so I want to loop that back in, because what we want to see in the state DOJ case is consistent with what Ms. Jamison was raising and consistent with what Dr. Ferrentinos was talking about with the linkage to services. What we want to see is more downstream services. So we want less beds because we don't want people having to go upstairs. What we want is people to be getting services before they interact with the police, right? So that includes services like assertive community treatment, services like mobile crisis, and in Portland, that's called the behavioral health response teams. And if you guys don't know about the behavioral health response teams, talk to Lieutenant Hager. The model that they have here is consistent with best practices, which links a social worker with a police officer, and they go out and they intervene before something raises to a crisis. They try to link the person to services so that person isn't involved in a crisis that would result in someone being taken to a psychiatric emergency service. So assertive community treatment teams, mobile crisis teams, peer services, and along with that sort of array of services, we're also looking at more jail diversion programs, and then along with that, supported housing and supported employment, because those are the things that will help stabilize individuals. So all these sort of downstream services is what we're hoping to build by working with the state in that investigation throughout the state. Obviously, Multnomah County is the biggest population base.
Time is about up,
okay.
Adrian.
Okay. So anyway, so we do believe that just to respond to the issue about the aspirational part of this agreement, while the city is not a provider of mental health services, which is why we cannot hold the city accountable, why it's not a measurable aspect of the settlement agreement, we are hopeful that, yes, the walk-in drop-off facility that Dr. Ferrentinos talked about is something that will create services that will help prevent people from further interacting with the police as they get linked up to services, which is what we're interested in seeing both in our statewide investigation and this case. We hope that that answers some of the questions about how those two things interrelate.
Thank you.
Thank you.
Alicia.
Quickly, because I just wanted to, so what I heard you say, and I want you to repeat it, for the purposes of the work that we are doing here,
right,
the downstream 29 beds actually does satisfy the requirement in terms of meeting the needs of a drop-in center. Did you say
right,
that?
That's our hope. I mean, as Dr. Ferrentinos mentioned, it's still a model that's working, and we're watching it. We did meet with her to get more information about it. So what we want to see and what we hope all of you can provide in your roles as being the service of the COAB, and as well as the role in providing recommendations, is to continue to push the city to be involved in that. And we want the city to be involved in making sure that that downstairs facility has those services, has peers involved, stuff like that.
And it does. And that's the thing, is that the emerging model currently does have peer wellness specialists and peer mentors. And I think it's consistent with you say hope, but it actually is happening. So that's
great.
Thank you for the clarification.
Yeah, that's great.
Okay, Sharon.
Thank you very much. Oh, were there more questions?
So with the state actually providing training for like 100 community health workers, does that tie in at all for working with the Olmsted, with that agreement? And as we're moving forward, the fact that the city is not responsible, but the county is, it just doesn't make any sense that, here we have municipalities that are not being accountable to make sure that the wellness of the people in the city that they govern are being taken care of in a way that will prevent the prevention of further deterioration that actually causes the city and the county and the state to spend more money on things that if there was preventive services up front, we wouldn't even be experiencing the type of things with the police having to step in and do intervention.
Sure. So 3 things there. Let me address. I'm not familiar with the training that you mentioned by the state, so I'd love to talk to you more about that offline to understand that better. But second of all, regarding the city is certainly, I don't want to confuse the issue. The city is certainly accountable for its citizens and accountable in the way the police functions in interacting with those citizens and the way other city bureaus function. However, the difference is that the city does not receive funding from the state to provide crisis services. So the funding from the state goes down to the counties, and now to some extent the CCOs are involved with behavioral health care as well. But funding, and this is pursuant to state law, goes to the counties for crisis services. So that's why it's just a different funding stream.
Thanks.
Yeah.
Okay.
Thank you very much.
Thank you. All right. Let's take care of some time business here. I think Commissioner Fritz wanted to have some time. Go ahead.
Thank you. I won't take very long. I just, first of all, wanted to thank the COAB for all of the work that you're doing. I am astonished as I'm sitting here tonight. I've learned so much. I'm so impressed with all of the work that you're doing, and I know you're just scratching the surface of the deep work that's being done in the subcommittees and all of the work that you've done for the last 6 months, and I'm blown away. And also at the amazing attendance by community members and the amount of intense passion and commitment that I'm seeing from the community, who are fascinated with what you're doing and wanting to be involved, wanting to be supportive, wanting to be challenging. And thank you for coming, and thank you for speaking and telling us of your loss. I'm so sorry that happened. And I think it's, no. And we want to make sure that that doesn't happen to another mom, or to another son, to another father. So thank you for speaking that and reminding us of why we're doing all of this. So I'm going to be coming to all of the meetings from now on. I will be inviting one of my council colleagues to come each time. I don't know whether they'll be able to. We can only have 2 of us here at a time, otherwise it's a quorum, and I know you've all been made familiar with that, but I know that others are passionate about this. And so I just wanted to tell you a few of the things that I'm going to be doing also. Tomorrow I'll be meeting with Commissioner Novick, who is in charge of the Bureau of Emergency Communications. There's several items on the list of things to do that are specifically under his purview, and we're going to work, I'll be working with him on that. I used to be in charge of emergency communications. I'm meeting also tomorrow with Lynn Saxton, who's the head honcho at the state on health services. I don't know her exact title. But I've been having some discussions with her about funding at the state hospital and also about funding for mental health care in general. So I'm convening a group with the county and other providers to look at those very questions of what do we need upstream and what do we need downstream, and how are we going to pay for them. And clearly we cannot pay for them all at the local level. We have a lot of people coming to our area, being discharged from our jail system, coming to our area. We need some help from the state, and so now is the time to start looking at the 2017 session to be making a much more significant ask for services, which coincidentally will be right when the Unity Center is open. So that piece needs to happen. And I worked at OHSU in psychiatry for 22 years, from 86 to 2008. And my husband was worked at the state hospital from 1990 until he was killed last year. And I don't recall this kind of discussion happening ever in all the time that I have been in Portland, that the system, through no fault of the people who've been involved in it, has been full of gaps, full of problems, full of lack of funding, and never have we gotten together to say, how do we fix the whole system from the beginning to the end? How do we make sure that if somebody calls and is in crisis, that they can see a psychiatrist or a mental health care provider sooner than 8 weeks? it's no wonder that our police are in the system where they are being called and asked to be providing care for folks without having had 4 years of medical school and 4 years of residency and all of the other attendant things that you get when you're in the mental health care system, which the police don't have access to. Thank you to the police who are part of this process. It's really hard, and I really appreciate what you're doing. Then finally, I do want to mention that I'm going to be meeting on Monday with the mayor and the Albina Ministerial Alliance Coalition for Safety and Justice and the U.S. District Attorney's Office. It's the I don't know if it's how often we're supposed to do it, but it's a conversation that we're supposed to be having to see amongst the parties, including the AMAC that was a party or a friend to the settlement, a discussion of how are we doing and what are we going to do next. So we're trying to cover all of the aspects of this, and I so appreciate your partnership. I also am finally now back in charge of the Office of Neighborhood Involvement after a 2.5-year enforced absence from it. So I'm now going to be working with Brad and in his work to provide services to everybody on the COAB. How can we help you be successful? We did have a brief discussion about stipends at the City Council. I indicated that I was absolutely interested in pursuing that. We're waiting to see if you want to pursue that. So I want you to know that I greatly value your service. I think that maybe some folks are able to manage this huge time commitment without compensation. Others might not be able to. And so I want to make sure that whatever you have, whatever you need, whatever information you have, whatever support services, if it's within my power to help you get it, that I'm open to that. And I encourage you to talk to Brad, who can then talk to me in a very timely and coordinated manner. Thank you so much.
Thank you. Hold on just a minute. We have a set of recommendations before us that if we don't vote on tonight, they won't make it into the process. So I want you to hold that in mind as you raise your hands now.
Fritz, for your presence and always your leadership. I was hoping that you might say a few words about the initiative that you're taking around the Truth and Reconciliation part of our work. Your leadership there is so important. Thank you.
Thank you, Senator. Just like I was moved and encouraged to do better by what you had to say, other people need to listen to and internalize the hurt that's happened in our community. So in partnership with Senator Gordley and others, I'm going to be convening a group, I think, next week. Christina Nieves, could you just wave? If you don't see me at a meeting, it means that I've got a prior commitment, but Christina will be here, as Dora Perry was from my staff before. And so we're going to be convening in the very near future a group to start looking at what would a truth and reconciliation process look like. Clearly, the COAB is not charged with doing that. You have so much on your plate that is part of your charge, and equally clearly, it so needs to happen that we need to figure out how can we heal in our community to allow you to do the work, which then will allow the trust to be built. And so I know that, Rabbi, you're going to be part of that group, and I appreciate that too. And I know some of the mental health care stuff. I know some of the political, how to get the money from the legislator stuff. I'm going to need help with the Truth and Reconciliation process because I don't know how to do that, but I'm very, very willing to help convene it.
Thank you. Philip?
Thank you, Commissioner Fritz, for your comments. And I just wanted to respond to one comment in particular. And that's in regards to police You know, we can't hold the police responsible because they didn't go to medical school. With all due respect, police are the ones who pull the trigger on those who have mental health issues, and I think that's important that we can't forget that. I think it's important we are representing a community who suffers, and just because police individuals didn't go to medical school doesn't take away that accountability piece. So I just wanted to kind of, your comment, I was a little, I guess I wanted to clarify my position and our position here is that police aren't somewhat off the hook for what they've done, if that makes sense, and other than that, thank you.
Thank you. Thank you for a good discussion this evening. I don't know how we're going to squeeze in the things that are left, that are necessary, that are important, without extending the length of this meeting. So I would entertain a motion that would do that. Philip?
Yes, I would like to ask all the commissioners I want to tell everyone, if we don't vote tonight, we're going to have to postpone to the next meeting, and I would like to avoid that. So I would motion that we extend the meeting by 30 minutes so we don't have to have another meeting. And can I throw that out there for a motion?
Been first and seconded. Any brief discussion?
The recommendations for the 1,500 training went out yesterday. And I know that we're all terribly busy, but I'm making the assumption that we all read them. And I would actually much rather us work on the assumption that they were read, since we actually bothered to do the work last week, and we make a motion to actually move forward with those recommendations and complete that task and end on time tonight.
You still have a half an hour set aside for discussion of the training that we have postponed twice.
And then that may have to go to another meeting.
Well, wait, the motion on the table.
I know, you said discussion. This was just in a
Okay,
discussion
yeah,
portion.
right.
We know what the motion was on the table was
No, I think
extend a
somebody
half hour.
thought you made a motion.
Oh, no, I didn't
Okay.
make a motion. This was
Okay,
just
all
me
right.
making a comment in the discussion portion after the motion was made.
Okay. So we have on the table a motion to extend the meeting time by half an hour. We have a second to that motion. All in favor of that motion, please raise your hands, raise your paddles. 1, 2, 3, 4, 5, 6, 7. Did you get everybody? Please raise your paddles again. Sharon, Bud, Siadam, Philip, Tom, Laquita, Rochelle. All opposed?
No, we need to be more efficient.
6. What do we got? Six yeses. 7 yeses, 6 noes. I think that means the motion carries, unless there's something I don't understand. Yeah. I think we can get through the,
I hope I know what you're going to suggest, and that is that we go through the training and get that done before the
No.
6 of us who might have to leave.
no, I
regardless.
want the proposals that the recommendations that you've
that's
made,
what I mean.
not the training part. The training discussion,
Right, no, I'm saying the same thing.
okay,
Yeah.
all right. Okay. We have 5 recommendations from the Mental Health Subcommittee. I would like to take them one at a time. We have people signed up to testify on different parts of it. So the first recommendation is that a glossary be added, a glossary of names and definitions of names and terms and policy be added to the documents, the training information. And I think that's pretty clear. Can I get a motion to second? What? What's the matter? Oh, okay, all right. So we got a first and a second, and any discussion? Tom?
Was there any input received from Portland Cop Watch or other people in the community about the recommendation?
Go ahead.
I'll respond to that. Yes, this was actually brought up by members of the community, and there was a great deal of discussion and support for this by members of the community.
Okay, any other questions? All in support of passing this recommendation on, please raise your paddle. I think all of our voting members that are here just voted yes. Okay. Any noes? Any abstentions? The second recommendation is adding language regarding delivery and instructors, that training instructors include more voices from outside Portland Police Bureau, including community members and individuals with lived experience. And no, you can't. And I have here Dan Handelman that wants to speak to that.
On this point, I would just like to say that having 5 sign-up sheets for this one item was very, very confusing. But I do want to talk to this particular point. It's been a suggestion of the AMA Coalition that came from community concerns for many years that the police should involve all communities in the training. So I know it talks about persons with lived experience, but I think all members of the community should be involved in the training, delivery of training to the police so that they understand what community members are concerned about when they're getting delivery of the training. I also believe that your motion to extend the meeting would have passed because it only requires a majority vote unless it's a major decision, and I don't think the length of the meeting is a major decision.
Right.
So just as a point of order.
Yeah.
Oh,
Right.
I thought you said you thought it failed.
No.
Oh, okay. I didn't hear you right then.
I will point out, Dan, that what it says is including community members and individuals with lived experience. So both are there in that recommendation. All right. Motion? Second? Second was Seatum. Alicia was the motion. All right. Any more discussion? All in favor? That's all of the voting members here are in favor? I don't know where Rochelle is. Rochelle, we're looking at the second recommendation. Are you okay? V, are you casting a vote on the recommendations, V? Okay. All right. All opposed? All abstentions? Passed. The third recommendation, recommend that training include a cultural responsiveness to the houseless community, those impacted by mental illness and other marginalized communities. And we have 2 people who want to speak to this. One is Dan Handelman, the other is Trudy Cooper.
I'm going to pass.
Okay.
I'm sorry, I'm trying to find your sheet again here in my big, huge packet. So this is an important recommendation. We've talked for a long time at Portland Cop Watch about having not just cultural responsiveness to the houseless community, but having an immersion program for the police so that they have to live on the streets for 24 hours at least, see what it's like to be a homeless person. And we said that if they did that, that we would then go on a ride-along. But at that time, I didn't know we had to do a background check to go on a ride-along, so we'll have to reconsider that policy. Anyway, I don't think I signed up for another section of this, so I'm just going to say that I was at the Training Advisory Council meeting last night, and they also talked about this directive there. And the point I don't think they quite got to is that this directive doesn't order that the police training has to match the policies. It says they cannot train to policies that haven't been signed off by the Portland police chief, but it doesn't say that the training has to match the policy. And I'm hoping that you, I know you have a long meeting already, can add that to your recommendations somehow. Thank you.
Any discussion at this point? What Dan is saying is that he would like for your recommendation to include that the training follow the policies. Okay, we got Rochelle proposing that we add that as a friendly amendment to the policy, and V seconded it. Any discussion? Tom?
Dan's recommendation is spot on. I mean, it's one of the classic problems that the police bureau has had, that the train division does not train to policy, and the trainers then defend officers who take lives. And so I heartily recommend or support the amendment.
Okay, any more discussion?
Can I just have a comment? When this policy was brought forth to the subcommittees to do the work to, you know, I would really appreciate moving forward that a lot of this be done in the subcommittee, because there was an opportunity for all of the subcommittees to review it, and when it came to the mental health crisis response subcommittee, we did most of the review. So I just want to put that out there.
Tom?
With all due respect, our subcommittee is overwhelmed with work. We could not address the training directive. I have concerns that the training directive has not been looked at with an eye to best practices. I'm concerned it hasn't really been vetted by the community and certainly not by our subcommittee. And so I want to be on record that it wasn't because we're not concerned about the directive, but we didn't have time. We just don't have time.
Okay.
And I want to be on the record that everybody who works on the subcommittee is exceptionally busy, and it has to be made priority at some point. No one here is twiddling their thumbs. So
Excuse
let
me.
that be on the record.
Okay, Alicia. Abel?
Madam Chair, I'm going to need your help with this. I think it's important that we put on record the responses from people who were asked to review the training protocol. I'm thinking of State Representative Lou Frederick. We have his
Right.
letter on
We have his-
file.
yes, we have one from Chip Lazenby.
Right.
We
And
have
then, Dante James
Dante James's comments also.
reviewed
yes.
the documents.
Yes. Rabbi?
Just a point of information on the item that's on the table now. Is this an item number 6, or is the intention
This
to
is
include
item
it?
number 4.
I understand, but there's a recommendation on the table to add some language, and I don't understand where that language is going.
Oh, you're asking if it's an additional item, an
Correct.
additional recommendation?
Correct.
You know, I guess that might be the best thing to do, what it came in as a recommendation, I thought, on the policies, and that to be added to that was a recommendation that they, officers be trained to the policy. Perhaps it goes with number 5. I was not prepared for this addition. What it means to me is that we could pass 4 and add this to 5, if you choose to pass 4.
And then can we have specific language of how it would be added to 5, please?
To 5, recommend this policy outlines the specific training that Portland police officers do receive, should receive, will receive, and that they include the training recommended by the Mental Health Subcommittee, and that officers be trained to the policies of the Bureau. That the training be shaped to reflect the policies of the Bureau.
Seems an odd addition.
Seems what?
An odd addition. But I wonder if it should just be a separate item.
We can make it a separate one. I'm willing to accept that. Okay? So let's just go through 4 and 5, and we'll consider number 6, the recommendation to train to the policy. Okay, number 4. Policies include clear attribution of who developed the policy and a clear contact with that person. Any discussion? Can I get a motion? Can I get a second? Okay. Number 4. Okay. All in favor? All right. Who are we missing? Hold your paddles up, please, so we can count them. So, Bud and Sharon did not vote. All opposed? Abstentions? Yeah, 2 abstentions. Now we'll look at 5. This 1500 policy outlines the specific training that Portland police officers do receive, should receive, will receive, and that they include the trainings MHCRS recommended months ago, the trauma-informed care, see original recommendations. Any discussion? The original recommendations were some months ago, and they're in your package. Sharon?
I have a comment. I just want to say that even that we received the information last night, and I did not have an opportunity to review it, and the fact that we're making these recommendations without being able to give input to it, and we are busy, and so I just want to go on the record to say that I would like to see that this one be amended to reflect in regards to cultural competency within the ranks of best practices of officers that bring value to the police bureau as far as the training.
Abel, Rochelle, and Paul.
Madam Chair, and to Sharon, the issue that you are raising is so important, and I believe it is addressed in the original recommendations. And what I would ask is that the co-chairs of the Mental Health Subcommittee summarize those recommendations rather than us running past them briskly. Let's put them on the record for the audience, the listening audience, the viewing audience, so that people know what it is we're talking about here.
So in essence, it was that we wanted, it addressed having more sort of cultural responsivity training. It also addressed the issue of trauma-informed care being a basis for training in essence. And we still need to have some education to the larger community and also the COAB about what trauma-informed care means. I mean, that is in a nutshell, but the recommendations are also in your packets. But that's essentially, briefly in a nutshell, what we recommended.
The language, Sharon, the language in one of the recommendations reads as follows. This may be helpful to you. Require all PPB officers be adequately and sufficiently trained in cultural competence, and further that the cultural specificity and diversity is reflected among the officers and through the behavioral health unit. More explicitly, we recommend that BHU contract with culturally specific mental health providers for mental health interventions.
Great, thank you. I appreciate that, because that wasn't clear.
Okay, I've got Rochelle, and then I've got Paul.
Say that these recommendations have been on the forum for the last couple of months, and so they were available for anybody to read.
Paul?
As I look through the recommendations, I see things regarding the training division, obviously 1500. I also see stuff that directly to BHU, and I hear Mrs. Brown talk about how we should probably talk to Lieutenant Hager regarding the best practices that they are following. Has there been any presentations by Lieutenant Hager regarding any of these, or from anybody within the training division?
Yes.
So I can answer that. Actually,
Wait.
Lieutenant Hager actually did in our subcommittee meeting, and there actually is also attached to this a list of priorities and recommendations, and one of those recommendations is to have the behavioral health unit come and formally present to the larger COAB and the public to give greater detail. So we are in the process of making a formal ask, but I'll also let her speak for herself since she's there.
How about anybody from the training division regarding
No.
We had-
1500?
Didn't we have a general presentation from?
At the beginning.
Yes.
At the beginning, yes, but
Yeah,
more
okay.
specifically, more
No,
recently.
I mean, at our COAB meeting.
Yes.
Okay, all right. Wait, I have a hand here. Lieutenant Hager.
I know I've made the ask a couple of times that it's important for this group to get a presentation from the behavioral health unit. And I have had some opportunity to talk at the mental health subcommittee, which is much easier in that smaller group setting. But even some of the recommendations that have come out there would be much more clarity and understanding of what's already been done. So some of these recommendations are actually repetitive of work that's already been accomplished, that this group would understand tremendously more if I had an opportunity to bring some of the behavioral health unit people in and give a presentation. And I have been through this draft COAB work plan through February of 2016, and I don't see the behavioral health unit anywhere on this. So, I mean, this committee can keep doing work, but an imperative piece of this is how the police have already responded, what we've been doing for 3 years, working on this agreement, and you can't possibly get all that just by reading documents. In fact, an hour of our time won't even cover it. So I can't stress the importance, and I don't know who makes this decision, I can't stress the importance that I need an official invitation from this group to my bosses to tell me to come. It needs to be done.
Okay, right now, just then to explain. A lot of what's being driven is being driven by policy review, and part of wanting to get those 2 meetings is so that we have a meeting so that people don't feel like they have to do everything in 20 minutes. And people can ask questions, and people can get answers that inform the next meeting they go to and their decisions.
I just would like to say that though the real big piece of this is, does the community know? Are they aware of what the police bureau has done with the behavioral health unit in knowing that the culture is being changed? Because that's the key. I mean, we can.
Let's go back to what we're doing.
Yeah, we got to finish.
We have not finished the recommendations. I think we were on number 5.
Yeah.
And we were talking about the outline of the specific
went-
training, et cetera. Pardon me?
We went to and we, just for context sake, we said that we wanted them to include the recommendations that we had made with the mental health crisis response subcommittee months ago.
Right.
Okay,
That's
that
all,
include the
that's
trauma.
all in there. That's
Exactly.
just, we're leaving that as it is.
Yep.
We're looking at a 6th one in a minute, okay? Any more discussion? Could I get a motion?
A motion.
Second? All in favor of approving the recommendation, please raise your paddles. All opposed? All abstentions? Okay. The 6th recommendation that has been added as a result of feedback from the community, from CopWatch specifically, is to recommend that the training developed for officers be tied to policy. That training be tied to policy. That suggests that all training would be informed by overall policy. Tom?
Well, it needs to be more specific. The training needs to follow policy, period.
Well, say some more about that, please. Okay, hold on. Can you say some more about that?
training needs to be consistent with the policy. I think it's more than just being informed. They need to train to the policy.
Okay, and I think that's what I mean too, but okay. Jakari?
Paul, does our training not follow our policy? For Paul.
When we develop a program and develop a lesson plan, it's developed around the policy. It's direction from the chief's office. It's approved. So yes, it does.
So I'm confused on where we're getting our training doesn't follow our policy, because that's the reason why we train.
That's a sentiment in the community. And it's not, we're not going to argue about whether it does or doesn't at this point,
But
because
that's
if it does.
But that's what we're talking about right now.
Right,
And
but
we keep
if-
glossing over that.
No, we're not glossing over it.
But we
If
are.
it does follow policy, the recommendation it just stands and it's there, and we will get the information or try to get the information that it does and how. What I want to hear is, again, what somebody said is it doesn't follow policy, so what is it that informs that position?
I would like to know what evidence.
That's what I'm asking.
Okay.
All right,
Like to
Dan,
see it.
would you like to speak to that?
The Aaron Campbell case specifically came down to a disagreement between sergeants in the training division and the lieutenant in charge of the training division about whether or not the training and the policy matched each other, and that the sergeants split with the lieutenant about whether or not the officers in that case followed their training. So that's why the community is concerned about this issue. And the point is that if the Bureau is already doing this, then adding this language is not going to hurt anybody or anything. So I don't really understand why there would be an argument against putting this language in the policy, just so that it's very clear. So in the future, if anybody who's not at this table now or not in charge now reads the policy, they know that that's how the training is done. Right now, it's not clear because of the way the policy is written.
Bud?
Question real quick, and this is directed to Paul. Do you know if the Office of the Auditor audits the training for conformance to policy today?
Do I know if that's what's in his report?
Do you know if they perform the function of auditing the training against policy specifically to answer the question of does it conform to policy?
I don't know. I'm not, like I say, all the programs that I've been involved in follow the policy now. You know, with Dan Handelman talking about, did the officer follow the policy? Well, that's different than the question that's being asked, is that is the training following the policy?
Abel?
Ask Dennis Rosenbaum if he has a comment on this particular, or observation, reflection on this particular discussion. Help us out.
Microphone.
You need a microphone, Dennis, please.
I don't have the same strong feelings about this issue that some of you do, because I feel that the major gap is between, is the training adequate is one question. There are trainings that may not even be, one of my concerns about it is that there are trainings probably that are not in policy, and so therefore can we not have any training that doesn't follow policy? We might want to we want the police to train on, is there a policy for every training? That's an interesting question for me. The bigger one here really is the gap, the Campbell, the other cases really, it's the gap between training and actual behavior on the street. Yeah. And is that training adequate? You do need policy. I mean, the Justice Department is focused on that, and I think that is important. You got to have the policy has to have the right elements in it. I don't know, maybe Tom has strong feelings about this, so I think he needs to articulate them a little bit more. Maybe Tom, do you want, pardon?
Do you think it needs to be, do you think we need to have that as a recommendation? What's your thought? I mean, is it a heaven or hell issue? Do we really need
No, I don't think it's that important. I mean, but that's just, I just think that it doesn't, I don't necessarily agree with Dan though either. I mean, I think that it doesn't kill anybody to put it in there. I mean, yeah, of course, it's to me, it's self-evident that it should be, but I don't know that it's going to help. But, you know, I wouldn't spend too much time on this. I think that there's a lot of other issues that you, but if people who really feel strongly about this, I think they need to articulate what the issue is here. So I don't.
Excuse me? Tom?
I have never heard of a suggestion, which I'm hearing
Excuse me.
tonight from members of the Police Bureau, that they should be able to train without having it be to the policy. And if they're suggesting that they're not taking that position, and that's what they do, how can it possibly hurt to have it as part of policy? And when you talk to people about best practices, what they tell you is to reduce the discretion that officers and trainers have that lead to killings. You want things specific, and you want them defined, and you want it limited. And there is no reason not to require the police department to train to the policy, as opposed to allowing trainers to have discretion to train outside of the policy.
Okay.
So I moved,
So, yeah.
I move to do that.
You give us the sentence. What is the motion, please? Let's hear the motion clearly, please.
I move to recommend that the Police Bureau require that its training be to the policy, consistent with the policy, and not outside of the policy. Whatever the policy may be they're training about.
Okay. That's the motion. I saw some seconds. Philip, a second. Okay. Discussion. All in favor of this motion, please raise your... Oh, I'm sorry.
I'm sorry to do that, but the language that we just heard is different than the language we had originally. So is the vote now on the language that Tom just gave?
Or on being
I think Tom is the one that put the motion on. I don't think we had... Did we have a motion on the floor before? I didn't think so. I thought we were having a discussion.
So I'm being consistent with policy.
Did we?
So
Okay, there was a motion. Who made that motion? No, he can't make the motion. He can't make the motion. He made the recommendation. I didn't think there was a motion. I thought there was a discussion. The point, if there was a motion, did somebody make a motion other than Tom? Then there was no motion. Tom has made a motion. Can we get a second to it?
Second.
Tom just, yes.
The language that Tom just gave is the
Right.
motion. Thank you.
Can I get a, did I get a second? Phillips seconded. Okay. All in favor of this recommendation going forward, please raise your paddles. Okay. You got them? Keep them up for a minute. We're getting old and slow, tired. Okay? Opposed? You have 4 opposed. Got them? Abstentions, please. You have 1 abstention. What do we got? Because?
It's a major action which requires me.
Okay. So it does not pass. Did you hear why?
No.
The distinction is made between major and minor actions on the part of the COAB, and what it takes to pass something as major is, we'll take 8 on this committee. And this is considered a major recommendation. That's the rationale right here. Go ahead.
I would move that we make number 6 that police training be consistent with the policy, period.
How is that different from what Tom said?
There were a lot of qualifiers and additions to what Tom said, which is why I didn't
Okay.
agree to it.
Okay, we have another motion on the floor. Second was by Rabbi Kahana. Discussion? All in favor of the motion as, whoop, okay, Philip?
I don't understand what the motion is, because the first motion failed. That means the second motion is this, it's the same, so we're doing the same motion again. I'm trying to understand what's happening.
Would you explain the difference between your motion and Tom's motion?
You could read Tom's motion verbatim.
Thank you. So, Tom moved, that the Portland Police Bureau require training be to the policy, consistent to the policy, and not outside the policy. That was the language.
Just saying, I'm saying consistent with the policy.
So you're narrowing it down to consistent with the policy.
Yes.
But how is that any different? If the first proposal failed, doesn't that mean the second proposal is basically the same? It's pointless.
You don't have to train to the policy, but your training must be consistent with the policy. It's actually a subtle but significant difference.
Okay. We have a motion. Wait a second. Second for Jimmy. Okay. All in favor, please. 3. Yeah, almost everybody. Got everybody? Okay. All opposed? Abstentions? 2 abstentions. Okay. I think that takes us through the recommendations that I thought we were going to get through in 5 minutes. We have 8 minutes to discuss the Civilian Academy training. This is the second time that we've tried, or is it the third? Oh, the motion passes. I'm sorry. I am distracted. This is like the second or third time, I can't remember anymore. Third time that we've tried to have this discussion, and it hasn't happened. Rabbi Kahana, you have your...
Thank you. I'd like to make a suggestion, because I think I very much want to have this discussion, but it's also it's not a simple discussion. I don't think this is just a matter of giving individual reports. I think it's a lot of conversation. I'd like to suggest that we make that part of the agenda for the COAB retreat.
Okay. You got a proposal and a second, a recommendation?
I don't know if this needs a vote. I mean,
Okay.
this is an
That wasn't
agenda
a
item.
proposal.
Well, I got the second down here, so I reacted.
I have
Any thoughts on that? Any other thoughts on that?
Good idea.
Sound good idea? Okay. Gee, that means we could end 5 minutes early? Okay.
Or 25 minutes late.
All right. The stress of trying to squeeze 3 hours worth of information and dialogue into, a half an hour. We meet for 3 hours, it's not enough, and it's constantly not enough, and stuff is steadily backing up. Again, I ask for innovative ideas on what to do. We're constantly trying to streamline processes for communication to minimize the amount of work that people have to do to get us information or for us to get out. I want to let you know that we're meeting on Monday to start doing our agenda for the next COAB meeting. I apologize to you again for the short turnaround time on papers and agenda. That will change. Rabbi Kahana.
Thanks, Madam Chair. I'd strongly suggest or echo a suggestion that was made earlier to have a timed agenda, both beginning and ending time, and that the chair be empowered to keep us to that agenda.
I struggle with that. I'm going to be very honest with you, because you ask questions, and it seems to me this is the place for you to ask questions. You have someone in the room. I think what we could do is, instead of saying, okay, this is going to happen in 20 minutes, you're only going to use 20 minutes, is just go ahead and put an hour there. But then that knocks something else off the agenda. Now, you get to tell me what you want, and I will do that. But when there's someone who is telling you or giving you information that you've asked for, or that a subcommittee has brought forward and we've said, okay, what are your reasons? It seems to me if you keep asking questions, I feel like I should let you go ahead and ask questions. Now, there are other options. I can just say stop. I don't mind saying that. And I have times on my agenda. And I have horrors about it.
It's amount of time. I think just personally, it's only a recommendation, but I think it does enforce a bit of discipline on our part. That we know if we're going to go over this amount of time, then we're going to trade it for something else.
Okay.
But I think what winds up happening is we're not watching the clock. We keep moving along. I think that it would just help us.
I am willing. Philip, and then Seattle.
Just to put this out there, my understanding is the subcommittees are focused on discussion and making recommendations, doing data analysis, and then COAB as the full group is for voting. It's for bringing it here and then getting it done and voting and sending it to the COCOL. That's my understanding. So this extension with the conversation and I don't know, it's just an idea that I'm throwing out there is what was my understanding. There's a lot of discussion that happens here. And I mean, there's a lot of information that we have to process and get through, and it kind of messes with the flow of this group, I would say, having all of that discussion.
I would say that there are things that need to be discussed here because they've been discussed in a subcommittee does not mean that everyone feels informed enough to be able to take a position.
Right.
And so we bring things here, and that's why they get to be passed by the full COAB. That is, everybody understands what's going on. So we've tried to, or I've talked about having a cover sheet for proposals that gives you basic information so that you can look at that sheet and know what we're talking about. But it also depends on us doing a better job of getting information out to you more quickly, earlier, okay? You had your hand up, Seattle.
I also think it's important to understand what information might be contextual to our main purpose and what information might be the content of what we're here. Just another way of saying it. So we heard a lot of contextual information tonight and didn't have enough time for the content pieces that we wanted to pay more attention to.
Another thing is I can restructure the agenda so that all business stuff happens first. Okay? And just make our agenda so that the business gets taken care of first. And that leaves whatever else in terms of presentations happens at the second part of the meeting, and maybe that'll help. Dennis?
Whoever recommended it earlier, I think maybe the rabbi, the issue of timing. I mean, I also think that the public expects to be able to speak at a certain time. People come, if you're going to have speakers and they're going to be later, I really think that sometimes things would have to go over if it's a crisis or something, but rarely should it. And I think they really want you to enforce that, right? I mean,
that's what I'm hearing.
So I think that it says from 7 to 7:15 we're going to cover this, and it's over at 7:15, and whoever's people get a minute to talk, not 3 minutes, whatever it takes. So.
Okay. Yeah, but
my suggestion is, thank you. Not that we so much rigidly and blindly enforce time limits, but that we entrust you as the chair of the COAB to decide what serves the interests of the people of Portland best. And then if you say this is off topic, put it in the parking lot, then we will support you. We will entrust you with that gavel. And I don't think we're using the parking lot enough. I think we need to use it more.
Okay, I'll agree. All right, Philip, and then Abel.
Another suggestion might be to have, if we're doing 2 meetings a month, have one meeting focused on all of the business aspects and the voting, and another focused on information and the presentation part, and that might work out better.
That's what yes, that's what I'd like to do, but Abel? Yes?
Well, and if you feel you want that, then if you feel like that would make it better, then do it.
Well, do it requires you showing up. And do it requires your agreement. I do have some limits to what I can.
As we close, I would just like to acknowledge that we have a student who's been observing our meeting this evening, Brad Taylor's son, Frankie. And Frankie, did you tell me you're in the 8th grade? Okay, your assignment is to write a reflection on all that you heard this evening.
Oh my gosh.
And I think it's wonderful that you're here and that you are observing this process, and I do look forward to having a conversation with you about what you heard.
Okay, so thank everybody for being here. You have empowered. Yes, Rochelle.
Meeting this month?
No. Second meetings wouldn't start until February. Our agendas are like filled up. But given tonight's conversation, I will re-examine those agendas, okay, to see if there's space that we can make. But right now we're looking at agendas that we've already made out, basically the skeletons of, all the way into February. Yeah. Yes. Amy's reminded me there's a town hall meeting in October. That would be the second meeting for this group, okay? I can't hear you. Yes, in October, yes, yeah.
Second meeting in
okay, thank you for direction. Thank you for the suggestions. And I expect then that when I ask you to stop, that you don't say to me, please wait a minute, okay? Because I depend upon your cooperation to make this work. And if we're gonna make it work, this needs to be a dynamic. I don't want to get into a public fight with anybody about your time limits, okay? It is working, it's better. Okay, I get a motion for adjournment? Second? All opposed?